Very good morning, all of you. Very good morning. Am I audible? Is it audio, video, is it clear? Can anyone reply me? Welcome to NEET PG Marathon Series. And we are going to start with the forensic medicine today. Welcome to NEET PG Marathon Series. Yes, Raja Sai, good morning. Snehal, good morning. Dr. Ram, good morning. So, good morning, all of you. Yes. So, we are going to discuss some important topics can be asked from forensic medicine and toxicology in upcoming NEET PG exam, including some important BNS, BNSS and BSA sections, and some important one-liners and some important image-based questions, and here there some forensic mystery things. Yes, yes, fine. Yeah, it is also for FMG, so it will cover both FMG and everything. Yes, Rohit Maduru, good morning. Raman Singh, good morning. Everything clear, right? Yeah. Okay. So let's start with the workbook. So the workbook will provide you after the class, and all the images, all the important questions will be given to you after the class, that is along with the annotated diagrams. So let's start. Okay, good morning. Low sound. Now okay. Pinak Ghosh. Good morning, Shreya. Good morning, Shreya. Pinak, Snehal, Raman Singh, Dr. Ram, Rajasai. Good morning, all of you. Okay, that's fine, right? Yeah. So let's start with the first question. Let's discuss entire thing in question and answer manner. So that you can interact with me and we can make the class very interesting and interactive. Which of the following define offences and punishment? So very commonly asked. So previously they used to ask IPC, Indian Penal Code. So now it is BNS, BNSS and BSA. Which of the following define offences? Offences can be, say example, rape, murder, grievous hurt, simple hurt. So which of the following define offences and punishment? Punishment can be death sentence, life imprisonment, or imprisonment, or community service. So depending upon the offence, depending upon the crime. So it can be petty crime, heinous crime, organized crime, all this, right? So what is the best answer? So the best answer is, so very good, most of them they answered, the answer is BNS. So you know BNS that define offences and also it gives the punishment. So BNSS basically your CRPC, you know, criminal procedure code. So that is related to investigation. So BSA basically Indian Evidence Act, that is basically the evidences to be collected and to be submitted in court of law. So whenever question asked, offense and punishment BNS, investigation BNSS, evidence, that is BSA. So you can see here, so BNS means offenses, BNSS means investigation, BSA evidence, BSA is evidence. So BNS basically that is your IPC, BNSS CRPC, and BSA, that is Indian Evidence Act. So all the three are MCQ. All the three are MCQ. So this can be asked in your upcoming exam. Okay, upcoming exam. Okay. So now let's discuss about important BNS. So the BNS can be asked because in recent INICET they asked about 106 BNS and 116 BNS. So they might ask in upcoming exam. So let's discuss some important BNS. Let's revise. I think we discussed many times in Telegram classes and YouTube live classes. So 63 BNS. Can anyone answer what is 63 BNS? So one of the heinous crime, one of the common crime. So we do medical examination of victim and the accused. What is 63? Can anyone answer? What is 63? Shreya, I think Shreya, very good. So it is the definition of rape. So definition of rape. Rape definition. 64 punishment. 64 punishment. So punishment can be life imprisonment. It can be 10 to 20 years or life imprisonment in case of 64. Here is a question: 64(1) and 64(2). 64(2) is equal to custodial rape. Custodial rape. So this can be asked in your exam. Yeah. So write this in chat box. 64(2) custodial rape. Don't worry about the imprisonment. You just try to remember the BNS. 64(2), that is custodial rape. When rape committed by a man within the custody, it can be an advocate, can be a doctor, police officer, or any person in custody, guardian also. So custodial rape basically 64(2). Write this in chat box so that you write some points in the chat box. Write that in chat box so that you can interact with me. Then 65. Next is 66. 65 is not needed. 66. Yes, 66 is rape and murder. Rape and murder. So how to remember murder? There are 6 alphabets. So 66 is rape and murder, like example Nirbhaya case, or the person causing persistent vegetative state, that is 66. 67, when it is committed by husband. So during separation. So the husband having intercourse with the wife during separation without her consent, that is known as 67 BNS. So how to remember? You can see 7 alphabets. 7 alphabets. Husband and wife. Husband and wife. Okay. Yes, good. 68 is sexual intercourse. SI means sexual intercourse within the custody. Sexual intercourse in custody, or seducing woman within custody. Like example, employer having intercourse with the employee by using his power, seducing woman within the custody, then that is known as 68 BNS. Remember, it is not amounting to rape. It is not amounting to rape, but it is a punishable offense. That is 68. How to remember? 68, 8 is there. 8, you can remember 8 is equal to authority. 68, 8. 8 authority. 8 is there, no. It's pronounced like authority, that's why. So 68 done. Then 70. 70, you can remember 70 G. G 70, gang rape. So gang means more than one. 71, repeat offender. Repeat offender. Repeat offender. So all these are commonly asked in the exam. Okay, repeat offender. Okay, now I have a question for you. What is 88, 89, 90? Can anyone answer? What is 88, 89 and 90? Come on guys, can anyone answer? Joe, Shreya, can anyone answer? 88, 89, 90. It is something related to fetus. Abortion. Is it therapeutic abortion or criminal abortion? Criminal abortion with consent is 88 BNS. Without consent is 89 BNS. Death of the female during criminal abortion is 90 BNS. So 88 to 90 basically criminal abortion. CAB. So this can be asked in your exam. So previously 312, 313, 314 IPC. Now it is 89, 89, 88 and 90 BNS. Criminal abortion. CAB, criminal abortion. Okay, good answer. Then 22 BNS. 22, can anyone guess? So previously we used to study 𝐒𝐿𝐿's rule, that is 84 IPC. Criminal responsibility of insane person, that is 84 IPC. 𝐒𝐿𝐿's rule, Durham's rule, Curran's rule, American Law Institute test, irresistible impulse test, all these are rules of insanity. So 22 BNS, so it is nothing but your 𝐒𝐿𝐿's rule. 𝐒𝐿𝐿's rule. So all these are one-liners, can be asked in your upcoming exam. So I'll just summarize. 63 definition of rape, 64 punishment, 64 2 custodial rape, 66 murder, 67 husband and wife, that is 68 authority, 70 G70, that is gang rape, 71 repeat offender, 88, 89, 90, that is criminal abortion, and 22 is 𝐒𝐿𝐿's rule. Okay, now we have two more sections. Let's see who is going to answer. 106 BNS and 116 BNS. Can anyone answer? 106 BNS and 116 BNS. 116 BNS. Let's see who is going to answer. So one who answer will get 3D chocolate from me. Okay, in the group, 3D chocolate. Chalo, let's see who is going to answer. Death by negligence, very good. Rohit Maduru, very good. He said, sir, it is medical negligence. MN, medical negligence. 116, grievous hurt. So grievous hurt. Remember, in grievous hurt there are 8 subclauses, and the 8 subclause we used to study 20 days. Now it has become 15 days. So grievous hurt, it is 15 days. Now update, try to memorize this. This can be asked. Severe bodily pain, the person is unable to do ordinary pursuit for about 15 days, can be grievous hurt. Previously it was 20. Okay, so all of you write in the chat box, grievous hurt is equal to 15 days. Write this in chat box. Write this in chat box, guys. Write this. Yes, grievous hurt means that is 15 days. So do interact with me so that you can make class very interesting and you can keep me awake. You can keep yourself awake. Okay, and writing 1 time is equal to reading 10 times. That's why. Chalo. So all these are the BNS sections. Okay. Now important BNSS sections. So BNSS means Bharatiya Nagarika Suraksha Samhita. So basically related to criminal investigation. So how to do investigation in case of unnatural death, in case of dowry death and all. Okay, so here one more, try to memorize. This can be asked. 80 BNS. 80 BNS is equal to dowry death. Dowry death. So this is very, very important. Dowry death. Okay, this can be asked. 80, how to remember? 80 lakh dowry death within 7 years of marriage. the punishment minimum 7 years to life imprisonment. So dowry death, death of the female, married female within 7 years of marriage, when there is a history of cruelty towards the married woman and demand of dowry, then it is known as dowry death. So that is known as 80 BNS. Okay, 80 BNS is equal to dowry death. Good. Chal, Chandana Talla, very good. Now we have 194, 196, 184, 52. See, in INICET, they asked I think 194. So they might ask about 196, 184, 52. These four are very important. So 194 is your police inquest. Police inquest. So which is nothing but most common inquest. As you know, inquest is the investigation towards the cause of death in case of unnatural death. So there are many indications. In India, most common inquest is police inquest. So that is 194. 196, magistrate inquest. Magistrate inquest. So which is the best one? In India, best is nothing but magistrate inquest. So there are three common indications. One is custodial death. Custodial death. Second one, dowry death. Dowry death. Third one, exhumation. Exhumation. So there are three important indications: death in police custody, death in psychiatric hospital, death in jail, death during police firing, dowry death within 7 years of marriage, exhumation. So all these are the common indications of magistrate inquest. That is 196 BNSS. 184. Can anyone answer what is 184? 184. I am giving you a clue. Nirbhaya case. Nirbhaya case is example for. Nirbhaya case is example for. That is 184 BNSS. Can anyone try? Rahi Marwa, very good. Assault victim or rape victim. So basically, survivor of rape. It is a medical examination of. So medical examination of victim of rape. So whenever word victim of rape or survivor of rape, it is 184. Remember, consent is very important. Consent is very important. Consenting age is more than 12 years. So any girl of more than 12 years, so any victim of more than 12 years can give valid consent for medical examination, medical legal examination, as well as sample collection. That is also asked in your exam. So and that should be informed consent. When consent is not given, you must document informed refusal, asked in INICET exam. Informed refusal should be documented when victim is not willing for the examination. 52 BNSS, accused of rape. Accused of rape. Accused of rape. So in accused examination, consent is not needed. Try to memorize. In accused examination, the consent is not needed. You can examine even without the consent, even with a reasonable force. That is given in BNSS. So all these are important BNSS, can be asked in your exam. I'll repeat again: 194 police inquest, 196 magistrate inquest, 184 victim examination, 52 accused of rape. Good, good. Bharadwaj, Jasari, Adi, Rohit, all answering. That's really nice. So the question can be asked: what is the legal age for giving consent for sexual intercourse? Can anyone answer? What is the legal age of consent for sexual intercourse? SI, sexual intercourse, not sub-inspector, sexual intercourse. 18 or 12 years or 16 years. So it must be 18 years. 18 years. 18 years. For medical examination, 12 years. Medical examination, 12 years. Surgery, 18 years. Abortion, 18 years. Marriage age for girls, 18 years. Marriage age for boys, 21 years. Majority, major, minor 18 year, child less than 18 year as per POCSO. Okay, all these are commonly asked in the exam. Okay, good. Now I have a question for you, forensic mystery question. So you must be aware of this series we started long back. So husband having intercourse with wife of age less than 18 year amounts to rape if case is filed within 1 year. True or false? True or false? Let's see who is going to answer this. Come on, try to answer. Husband, consider he is the husband. So poor husband and minor wife. Minor wife. Anyway, marriage only not legal. It is illegal marriage. It is a child marriage. It is punishable under various sections of Child Marriage Act. Okay. So yes, true or false? It is true, and it is because statutory rape. Even with the consent, having intercourse with minor can be rape, including wife. But remember, according to Supreme Court judgment, the case should be filed within 1 year of occurrence of the incident. Supreme Court judgment is there. As per Supreme Court judgment, case should be filed within 1 year. This can be asked in your exam. So this is the law of limitation. Law of limitation regarding this case. What is the law of limitation in case of medical negligence? Can anyone answer? Law of limitation. Limitation in case of medical negligence. Can anyone answer? How many years? Consider a case of medical negligence, civil negligence. The case should be filed within how many years of the incident of negligence? 1 year, 2 year, 4 year, 5 year, 10 year, like that. So 5 year, 5 year, 3 year, no. So nobody has answered. So the answer is 2 year. 2 years. So this is known as res indicata. Res indicata. So all of you write in the chat box. So 2 years. Write this in chat box. Res indicata is equal to 2 years in medical negligence. It's a law of limitation. The case should be filed within 2 years of occurrence of the negligence. That is the meaning. So all of you write in chat box. Res indicata is equal to. Okay, so this is about the, okay, and I have one more BSA section that can be asked in your exam, BSA. So BSA, that is 26(1) BSA, that is dying declaration. Dying declaration. So remember, there is something known as dying deposition. Dying deposition is not followed in India. Dying deposition is taken in front of the or in presence of the accused and accused advocate and a magistrate. So BSA 26(1) is dying declaration. In dying declaration, no oath is needed, no cross examination, no leading question. It's a simple statement of the dying person. Okay, this can be asked in your exam. Dying declaration we discussed many times in live classes and in recorded classes. So dying declaration basically 26(1). Good. So the dying deposition in US, very good. Chal. So this is okay. So all of you okay? Understood? Shall I move ahead? Move ahead. Speed is okay, all of you? Speed is okay? All okay? Just give me the feedback in chat box. Do you want me to go slow or do you want me to go a little fast? Perfect. Okay, Shiv Prasad. Okay, perfect. Following is surest sign of antemortem hanging. See, antemortem means the person is alive. Hanging, hanging means suspension. So there is a suspension of body. In there can be complete hanging, incomplete hanging. Complete hanging, the body weight acts as a constricting force. In partial hanging, the head weight acts as a constricting force. The question is, what is the feature of antemortem hanging? Very simple it is. So either it can be dribbling of saliva or it can be La facis sympathic. So it is A more than C. A more than C. That is the best answer. So dribbling of saliva because of the stimulation of submandibular sublingual gland. So because of the ligature, because of the knot, so there will be dribbling. It is present opposite to side of knot. So say example, knot is there on the right side, dribbling of saliva present on the left side, and dribbling of saliva is absent in ligature strangulation. This is asked in your exam. And remember in hanging, so ligature mark, yes, okay, chalo. Now look at this. This is the dribbling of saliva. You can notice here. This is classical dribbling of saliva, where it is present opposite to the side of knot. So this is the surest sign of antemortem hanging. Now here one more picture. Look at this image. This can be asked as an image based question. In this image, a case of hanging where we can see one eye is open, other eye is closed, and pupil on the same side of knot, same side of ligature mark. So it is more dilated. So more dilated. You can see here, more dilated. What is this known as? This is asked in exam. What is the best answer? Bharadwaj, Jasri. So this is known as lay facies sympathic. Lay facies sympathic. And this is because of compression of cervical sympathetic chain, CSC. It is present opposite to knot. No, not opposite. Opposite to knot is dribbling. Dribbling of saliva. So, but same side of knot. It is present on the same side of knot. Same side of knot. It is seen in 20 to 40% of the cases. It is not very specific. It is not very specific. It can be seen in postmortem suspension as well. But dribbling of saliva is a very specific finding. That's why it is a surest sign. Okay. Now here some more question can be asked. Now my question is oblique ligature mark. Where do you see oblique ligature mark? Where do you see transverse ligature mark? In case of hanging or in case of strangulation? Can anyone answer? Oblique, where it is seen. Transfer, where it is seen. My question is simple and commonly asked. Commonly asked. Let's see who is going to answer. Oblique in hanging, very good. Chandan Talla. Chandan, very good. Chandan, excellent answer. Oblique in case of hanging. Transverse in case of ligature strangulation. Ligature strangulation. And here one more question. What are the conditions in which horizontal ligature mark is seen in case of hanging? See, I said oblique ligature mark that goes upwards towards the nape of the neck. My question is, what is the condition in case of hanging where it can be horizontal or transverse? Transverse ligature mark in case of hanging. This is asked in INICET exam. I hope you remember. Horizontal ligature mark also can be seen in case of hanging. What is that condition? Can anyone answer? Can anyone answer this question? Yes, you are right, I said, but now bit difficult question. Transverse ligature mark also can be seen in hanging. What is that condition? Yes, very good. Adi answered. So, transverse ligature mark is also seen in partial hanging. Very good. Partial hanging. Or low point of suspension. Low point of suspension. Low point of suspension. I think Dhanumesh Bhatt answered correctly. Dhanumesh Bhatt, very good. So, and there is one more condition, hanging without ligature mark. Very interesting condition, hanging without ligature mark. So, in case of where soft ligature mark is used, when soft ligature material is used, like example sari or some soft material is used, then it can be ligature mark absent and it is a case of hanging. And remember, cause of death in case of hanging is asphyxia and venous congestion. The most common cause of death in partial hanging, venous congestion. Venous congestion. Try to memorize this. Partial hanging, venous congestion. Complete hanging, it is basically asphyxia and venous congestion. So, jugular veins are occluded at 2 kg, carotid arteries at 5 kg, okay, trachea at 10 to 15 kg, and vertebral arteries at 20 to 30 kg. So that is also asked in your exam. So that is given in the notes. You can go through that. So this is about the hanging, some related MCQ. Now hyoid bone fracture. So interesting question, hyoid bone fracture. So look at the image there, A and B. A and B. Can anyone answer where A is seen, where B is seen? So in A, the fracture segments are inward. You can see the inward movement of the fracture segment, inward fracture. In B, fracture segments are outward. So because here peritoneum damaged. So this is periosteum, sorry. So periosteum is damaged. So periosteum damaged at the outer side. That's why fracture segments are moving inward. So that is known as inward fracture. So this is known as inward compression fracture or inward fracture. Here outward, this is outward fracture. Outward fracture. Can anyone answer? Inward, yes, very good. Yes, inward, that occurs in case of throttling. Throttling. Outward occurs in case of hanging. Hanging and ligature strangulation. And ligature strangulation. And periosteum is damaged in case of hanging, that is on the inner side. So inner side damaged, fracture segments are moving outside. So try to memorize this. This is important concept. So periosteum is damaged on the inner side in case of hanging. That's why fracture segments are moving outward. So very, very important concept. So this is the body. This is a greater horn. So greater horn. This is a lesser horn. Lesser horn. The common site is here, somewhere at the junction of the anterior 2/3 and posterior 1/3. Okay, or medial 2/3 and lateral 1/3 of the greater horn. So and this hyoid bone ossifies at 35 to 40 years. This is also MCQ. So hyoid bone that ossifies at the age of 35 to 40, and the most common prevalence is around 15 to 20% of the cases. Yes, okay. So this image I will share with you in the after the class. You don't worry. This I'll share. So this, I think this workbook is there with you, right? Pinaki Ghosh. You can see here ligature mark produces prominent furrow, groove in the tissues, not characteristic. Salivary dribbling is present, absent. Leaf is sympathetic, present, absent. Drag marks are present in case of postmortem hanging. So this is the important one. This is there in the workbook, I think, right? Pinaki Ghosh. Yes, right. Next question. Next question from the workbook. Look at this image, manner of death in autoerotic hanging. So autoerotic hanging, very frequently asked. Harakiri is also commonly asked. Harakiri is a type of suicidal stab wound. But what about this autoerotic hanging, also known as sexual hanging? It is commonly associated with masochism. Masochism. Yes, okay, Bharadwaj, fine. Masochism and fetichism. Fetichism. Sometime transvestism. Transvestism. So this can be MCQ. It's common in males. So common in males, that is also MCQ. It can be seen in females also. So what is the best answer? Yes, that's fine. Bharadwaj, I'll share. No worry. Okay. So the best answer is accidental. Accidental. Certain degree of hypoxia or asphyxia can stimulate higher centers in the brain, especially pleasure center, so which can cause autoerotic hallucination. Sometimes this process can fail. This process, that can be sudden unconsciousness, and the person dies because of accidental hanging. So the best answer is accidental hanging. Remember, in judicial hanging there is a C2, C3, C4 fracture. C2 fracture is known as hangman fracture. Can anyone answer undertaker fracture? What is undertaker fracture? Undertaker fracture. My favorite, Undertaker in WWE. C2 is more common. Yes. Yes, good, good. So now it's not Jefferson fracture. Undertaker fracture is because of the, because of the transport of the dead body when head is unsupported. When head is unsupported, there can be a fracture of C7. So undertaker fracture is C7 fracture. C7 fracture. Okay. Yes. So this is about, and homicidal is also known as lynching. Lynching. And suicidal one is the most common one. So the most common method of suicide in India, your answer must be hanging. Parasuicide is drug injection. Drug injection. Okay. Can anyone answer what is the very important feature of autoerotic hanging? Look at this image. What is the very important feature? What is the very important feature of autoerotic hanging? So look at the image and try to answer. Try to answer. Come on, try. Yes, one is partial hanging. Yes, partial hanging. Very good. So it's a partial hanging. That's great. I think some student answering very well. Great. So it's a partial hanging. You are right. Foot touching the ground. That nothing but partial hanging. That's fine. Any other feature? Any other feature of autoerotic hanging? One is naked. You can see the masturbation there, seminal stain there, postmortem hypostasis in the lower part of the lower limb. That is all okay. And also there is a video recording there and some photos there, some dirty sexual material there. My question is one more very important feature of autoerotic hanging. Undressed, okay. Glow and stalking, that's fine. Any other important point? So remember, it is protective padding around the protective pad around the neck. Okay, and also you can see here Caesar there. You can also notice there. So protective pad is there, and also rescue mechanism. You can notice there. Can notice the Caesar there, cutter there. So that is the protective Caesar. So protective Caesar and protective pad are important features of autoerotic hanging. Autoerotic hanging. Good. So all of you write in the chat box. So autoerotic is equal to protective pad and rescue mechanism. Two important features. It's also known as yes, 𝐒𝐿𝑆varism, autoerotic hanging, sexual hanging. There are many names given to that. So pad and rescue. Write this in chat box. This can be asked in your upcoming exam. Important feature of autoerotic hanging is protective padding and rescue mechanism. Yes, very good. Good. Chalo. Now I have a question for you. What is the cause of death in A? What is the cause of death in A? And what is the cause of death in B? It's an interesting question. Very interesting question. Can anyone answer? So the first one is the complete hanging when total body is suspended. The B is partial hanging. It's probably in kneeling position, sitting position, prone position, supine position, the body touching the ground. My question is very simple. What is the cause of death in A? What is the cause of death in B? Yes, very good. In A, asphyxia and venous congestion. Venous congestion. In B, it is only venous congestion. Only venous congestion. Venous congestion. In A, constricting force is weight of the body. So, weight of the body. In B, it is weight of the head. Weight of the head. So, remember jugular veins 2 kg. Jugular veins are included 2 kg weight. Carotid arteries 5 to 6 kg. Trachea 10 to 15 kg. Vertebral arteries 20 to 30 kg. So, this is very, very important concept, very commonly asked in the exam. Okay. Yes, JCTV, very good. Atman, JCTV is mnemonic. Yes, good. JCTV, that's great. That's great. That's really nice. Okay. Chalo. Chalo. Good, good, good. Chalo. Next topic is your favorite, drowning. Drowning, drowning, drowning. Very commonly asked in the exam. Whether you like or don't like, drowning is commonly asked in the exam. So, drowning can be typical drowning, atypical drowning, dry drowning, hydrocution, shallow water drowning, near drowning. So, pathophysiology very commonly asked. So, here I am going to discuss about freshwater drowning. Freshwater drowning and seawater drowning. Can anyone answer? What happens in freshwater? What is the electrochemical gradient or what is the metabolic disturbance in case of freshwater drowning? What happens in seawater drowning regarding potassium ion concentration, regarding sodium ion concentration, and regarding hemodilution and hemoconcentration? Very commonly asked in NEET PG. Let's see who is going to answer. Let's see who is going to answer. Okay, okay, good. So, in freshwater, so there will be hyperkalemia, hemodilution, and hyponatremia. So, in Gettler test, chloride ion concentration is less than 600 milligram in the left ventricle. So, that is outdated, it is not used nowadays. Hyperkalemia, hemodilution, hyponatremia. In seawater, there will be hypokalemia, hypernatremia, and hemoconcentration. So, very, very important concept, commonly asked in the exam. In freshwater, the person dies in 4 to 5 minutes. In seawater, the person dies within 10 to 12 minutes. 10 to 12 minutes. Okay. In freshwater, the cause of death is, that is, ventricular fibrillation. In seawater, the cause of death is myocardial anoxia. So, all these are repeatedly asked. The Gettler test is outdated test. The principle is chloride ion concentration in left ventricle and the right ventricle. Okay. Yes. Crenated RBC, good, bradycardia and all that is seen, that's fine. So, now here one more question asked, what is emphysema aquosum? What is edema aquosum? So, can anyone answer? Emphysema aquosum and edema aquosum. So, can anyone answer? And question can be asked about pult of hemorrhages, diatoms. So, diatoms are unicellular algae. So they are present in case of antemortem drowning. So that is normally in the bone marrow and in the brain, especially in the systemic organs. So what is emphysema mucosum? What is edema mucosum? Can anyone try? Say example here, a case of drowning, and sometime the man is conscious. Sometime it can be unconscious drowning. In some cases in forensic medicine, so when we examine the lungs are emphysematous. They are dilated. There will be more froth in the lung. They are light. But in edema mucosum, it occurs in unconscious drowning. They are heavy and they are watery lung. So emphysema mucosum, where it is seen, edema mucosum, where it is seen. Can anyone answer? Yes, emphysema mucosum is seen in a live conscious drowning. When person is alive, when person jumps into water, so he inhale the water and he will try to exhale the water. There will be breathing efforts. When there are breathing efforts, so there can be more formation of the froth. So there will be more froth in the lung. There will be more dilation of the lung because of the breathing effort. So that is known as emphysema mucosum. Emphysema mucosum is seen in live conscious drowning. Edema mucosum seen in live unconscious drowning. So all of you write in the chat box, emphysema mucosum is equal to live conscious drowning. The person is live and person is conscious. When he is conscious, he will try to exhale the water from the lung. There will be breathing effort. So there can be more and more froth, and lung is full of froth, and on cut section you will see a lot of froth and lightweight. That is known as emphysema mucosum. Okay. Yes, all of you write in the write in the chat box. Yes, write this in chat box. Emphysema mucosum is equal to live conscious drowning. If they ask you surest sign of drowning, your answer should be cadaveric spasm with aquatic matter mud in the hand. Cadaveric spasm. So the question can be asked about the manner. The most common manner is accidental. So it can be homicidal, it can be suicidal. It's one of the method of dowry death as well. So one very famous case is murder of brides in bath. The murder of brides in the bath. So that is one very famous case of homicidal drowning. So drowning is a method of exclusion. The manner is a exclusion method. Yes, good answer. Ballooning of lungs. That's great. Yes. Now I have a question for you from Asphyxia, cafe coronary death due to banana. The very interesting scenario here. So the person, he was having banana under the influence of alcohol. So he was in the bar and restaurant. It's very unusual phenomena. Having banana in bar and restaurant is very unusual. But one case reported. In my experience, one case reported. He was under the influence of vodka and he was having banana. So banana was struck in the larynx and he died. My question is, what is the cause of death? Is it asphyxia? Is it choking? Is it vasovagal inhibition? What it is? Can anyone answer? What it is? That's great. That's great. Now I have an interesting question just to make the class interesting. I am showing you banana there and vodka there. Not a good combination, as you know. So vodka and banana both there. What is that? Very good. Dr. Dr. Sabha answered correctly. Sir, cafe coronary syndrome, the cause of death is vasovagal inhibition. So foreign body within the larynx stimulate the recurrent laryngeal nerve, superior laryngeal nerve, that leads to vasovagal inhibition and death. So that's why it is a sudden death. Sudden death. Signs of asphyxia are very minimal or they are absent. Signs of asphyxia, so they are absent. So this can be MCQ in upcoming NEET PG exam. What is the cause of death in 𝐒𝐄 syndrome? Vasovagal inhibition. How to differentiate it from the choking? In choking, there will be signs of asphyxia, congestion, petechial hemorrhages, and cyanosis. All these are absent in banana syndrome, 𝐒𝐄 syndrome. So, okay, yes, I hope you understood this. It's very interesting one. And look at this now. This is one more case. Fatal death due to food paratha. Again, one more case reported in forensic medicine. So, he was a beggar actually. He was beggar and he was having parota. And you know, parota is little sticky when you have without water or without any proper hydration. So, he was presented with cyanosis, petechial hemorrhages, and on examination congestion is there, and he died within 3 to 5 minutes. 3 to 5 minutes. So, my question is now, fatal death due to food paratha, what is the cause of death? Is it vasovagal inhibition, or it is choking or asphyxia? What it is basically? Yes, very good. So, this is basically asphyxia as a result of choking. So, choking, the question can be asked, Heimlich maneuver, that is the emergency maneuver in choking. Choking means occlusion of internal air passages. The smothering is occlusion of external air passages. Gagging, that is occlusion of pharynx. Okay. So, all these are commonly asked question. So, one is paratha syndrome, second one is the banana syndrome. Try to memorize both. And hydrocution is cold water drowning. Cold water can stimulate the nerve endings of vagus nerve. It can lead to death. Hydrocution means that is cold water drowning. Cold water drowning. Yes, choking there. Why not vasovagal? Atropine. So, try to memorize. So, in vasovagal inhibition, the death occur immediately, like heart attack, within few seconds or within 1 minute. But in case of choking, the person dies within 3 to 5 minutes. So, there will be some time for development of cyanosis, petechial hemorrhages, and congestion. So, when you see all the three, then it is basically known as choking. So, dry drowning, laryngospasm. Very good. Dry drowning is laryngospasm. That's fine. Okay. So, this completes the asphyxia. Any doubt in asphyxia, you can ask me. I think any doubt? Is everything okay, all of you? Okay. Any doubt in asphyxia? Anything, if you have any doubt, you can ask me asphyxia. And in asphyxia, it is there, you know, suffocation is important. In suffocation, traumatic asphyxia can be asked, positional asphyxia can be asked, and you know, methods of torture we are going to discuss in upcoming slide. So, drowning we discussed briefly here, there, hanging done, and throttling we discussed, head bone fracture. So, yes. So, is it okay? Throttling, okay. Throttling, okay. So, in throttling, what are the important MCQ? Throttling. So, there are 5 important MCQ in throttling. So, what are the 5 important MCQ? Throttling. Throttling is manual strangulation. Manual strangulation. In throttling, you will see CPC. Congestion, petechial hemorrhages, and cyanosis. In throttling, you will see 6 penny bruise. 6 penny bruise. There will be inward fracture, inward compression fracture. The cause of death can be asphyxia, or it is vasovagal inhibition. Vasovagal inhibition, and the most common manner is homicidal. 6 penny bruise is asked in the exam. All these are important. Extensive contusions. Yes, good. Good. So, this I will share with you in workbook, you don't worry. So, this notes also you can go through after the class. Throttling is done. Is it clear? MP Virtus, are you happy? MP voters, are you happy? So having vodka and banana, is it a good combination? Is it a good combination, a bad combination? So what happens, alcohol is seen as depressant. It depresses gag reflex. So when gag reflex is absent, the foreign body can enter into the trachea and bronchus. It can lead to death, or it can lead to vasovagal inhibition and death. So there are two chances are there. So lynching, okay. Lynching basically homicidal. So lynching is ligature strangulation, beta. Lynching is hanging. Lynching is a homicidal hanging. It is not strangulation, it is a homicidal hanging, because there is a suspension is there. Pinaka, there is a suspension. Good. So next topic is blunt force injuries. So very interesting image there. One of the very interesting movie, Pushpa movie. Hai na? So what are the injuries caused by blunt force? Can anyone answer? What are the injuries caused by blunt force? So blunt force, what are injuries? Blunt force. So this is actually sharp force. Okay, sharp force and also sharp force. Blunt force and sharp force. So a sharp force basically incised wound, stab wound, sharp wound. Sharp wound. Okay. Blunt force injuries are abrasion, bruise and laceration. So can anyone answer what is the very important finding of laceration? What is the peculiar feature of laceration? Peculiar feature of laceration. Let's see who is going to answer. Laceration, what is the peculiar feature? The one point is irregular margin. Irregular margin. Second is bridging of tissues. Bridging of tissues. So when you see bridging of tissues, it's most probably laceration. Laceration caused by blunt object, it has irregular margin. So there are different types of laceration: split laceration, cut laceration, tear laceration, avulsion laceration. There are different types of abrasion: graze abrasion, scratch abrasion, imprint abrasion, pressure abrasion. Imprint abrasion example tire mark, pressure abrasion example is hanging, graze abrasion example road traffic accident, also known as brush burn. Scratch abrasion example sexual assault. There can be minor abrasions over the thighs. So abrasion can be asked. Bruise can be intradermal bruise, migratory bruise, deep bruise, sixpenny bruise, so donut bruise. So there are many questions can be asked. So this is favorite of examiner. Bridging of tissue, swallowtail, that's fine. Look at this now. Injuries caused by blunt force, all except. So what is the best answer? Blunt force. So in case of stab wound, answer is stab wound. Stab wound depth is maximum. So depth is maximum than breadth, maximum than length. Stab wound. Stab wound can be of three types: punctured, penetrating, perforating. In perforating, there will be entry and exit wound. Entry and exit wound. And one more very frequently asked is harakiri. Harakiri. So harakiri is a suicidal stab wound. Harakiri is suicidal. Okay, good. Abrasion can be graze abrasion, scratch abrasion, pressure abrasion, imprint abrasion. So can anyone answer which is the commonest abrasion? Commonest abrasion? Commonest abrasion? Commonest abrasion? Let's see who is going to answer. Nishita, very good. So graze abrasion. Graze abrasion. Good. Now look at this. Look at these two images. This can be a question in your exam. Try to identify. In A, what we can see here, parallel lines. In B, you are seeing tire mark, like this tire mark. What is this A and B? What is this A and B? Yes, A is graze abrasion. Graze abrasion. The B is imprint abrasion or impact abrasion. It's also a type of pattern abrasion. Okay. And also by looking at the abrasion, you can tell about the direction. You can see here he put up epithelium here or skin tag here. Skin tag. So my question is, what is the direction? So example, this is right side and this is left side. So skin tag is present on the left side. My question is very simple. What is the direction of this abrasion in case of road traffic accident, where you will see graze abrasion or brush bone or friction bone there? Atropine, can anyone answer? So this is right to left. Right to left. Right to left. Good. So the question can be asked about color changes. Color changes of abrasion. Okay, that you can go through after the class. So I think who answered correctly? I think Bharadwaj Dasari answered correctly. Now next question about incised wound. So incised wound is commonly asked. All are features of incised wound except margins are clean cut and everted. So that is true. Caused by sharp weapon, that is true. Spindle shaped, that is also true. Tissue bridging, that is false. I said tissue bridging is commonly seen in laceration, not in case of incised wound. Done it is. D, yes, good. Now look at this image based question, a case of laceration. There is a finding there. What is this finding? A case of road traffic accident, and it's a type of split laceration, inside looking laceration. Insides looking laceration. This is nothing but split laceration. Split laceration commonly occurs over the bony prominences. Bony prominences. So in case of split laceration, you will see tissue bridges. So what we can see here is the tissue bridges. Tissue bridges. In case of avulse laceration, you will see flaying. The flaying or detachment. So this can be asked in your exam. Avulse laceration, you will see flaying, detachment, amputation or deglowing also. Okay. So this is about inside looking laceration, commonly asked in exam, very commonly asked, split laceration. It looks like an incised wound, that's why it is known as inside looking laceration. Now I have a question for you. Laceration looking incised wound. Can anyone answer? Laceration looking incised wound. Laceration looking incised wound. Can anyone answer? What are the sites? Yes, Adi, very good. Scrotum and axilla. Scrotum and axilla are the sites where laceration looking incise wound is seen. Good, good answer. So that's okay. Now we have one more image, that is about the defense injury. So defense injury can be active defense injury, passive defense injury. And what we see here, that is the incised wound. It looks like an incised wound. So what we can see, spindle shaped wound there. It is a incised wound over the back of the hand. So active defense injury is seen commonly over the palmar surface of the hand. Palmar surface of the hand. When victim tries to grab the weapon. So that is active defense wound. Passive defense wound, when victim tries to protect himself by giving hand like this. So passive defense injury. So the commonly seen over the back of the hand or back of the forearm. Okay. So my question here is it active defense wound or passive defense wound? Active defense wound or passive defense wound? Can anyone try? So this is most probably passive defense injury. Passive defense injury. This can be asked. Now look at this image, A and B. Just try to identify what is this A and what is this B. Fatapat. Look at this. And also remember, hesitation cuts are seen in suicidal injuries. Suicidal injuries. Defense injuries are seen in homicidal injuries. Injuries over the scrotum, back, the feature of homicidal injuries. Yes, let's see who answered. Yes, Karthik Madhav answered. Yes, Karthik, good answer. Karthik. So this is active defense injury and this is passive defense injury. Clear. Passive defense injury. Okay. Now cutthroat injuries can be asked. Suicidal cutthroat and homicidal cutthroat. All are the features of suicidal cutthroat injuries except presence of tentative cuts, hesitation cuts. Only one wound is deep. Presence of cadaveric spasm, presence of defense wound. So answer is presence of defense wound. So D is the answer. So defense wounds are seen in case of homicidal cutthroat injury, not in the suicidal cutthroat injury. Yes. So D is the answer. Very simple. And this is what given in your workbook. You can go through this. Suicidal cutthroat and homicidal cutthroat, very very important, very commonly asked in the exam. Just I'll skip. Chalo. Next is the firearm injuries. Firearm injuries, one more very commonly asked, especially entry wound and exit wound. So all are the features of entry wound except is there. Except. Come on, try now. Yes, abrasion collar because of the spinning movement of the bullet. That's a feature of entry wound. Presence of blackening is because of the soot particles. Presence of tattooing is because of the gunpowder. GP is gunpowder. So the answer is averted margin. In case of entry wound, it is inverted. But one more question asked. What are the different ranges of firearm? Different ranges of rifle firearm wound. So there are contact range, close range, near range, distant range. So there are 4 ranges. Can anyone answer? What is the feature of contact range? What is the feature of contact range? Like this, or like this, or like this. What is the feature of contact range? I'll go a little slow now because this is important topic, very commonly asked. Yes, little slow. In contact range, you will see imprint abrasion. So that is known as muzzle imprint. Imprint of the muzzle. and there would be very less blackening, very less tattooing around the wound. In close range, you will see blackening. Near range, you will see tattooing, and all these are absent in case of distant range. So frequently asked in the exam, ranges of the rifle firearm injuries. So in contact range, you will see muzzle imprint, inverted margin, abrasion collar, grease collar, inner table beveling and all. Close range, you will see blackening, near range, you will see tattooing, and distant, all these are absent. Yes, good answer. So many answering, that's great. Now look at this difference between entrance wound and exit wound. So the notes is given to you, you can go through the workbook. Next is important is blast injuries, frequently asked in the exam. Blast injuries, secondary blast injuries caused by multi-directional blast wave, flying missiles, victim displacement, structural damage. So blast injuries can be of 5 types: primary, secondary, tertiary, quaternary, and quinary. So primary is because of, like this question can be asked. So primary because of blast wave. The common organs are eardrum, intestine, and lung. Secondary because of the flying missiles. Flying missiles are secondary missiles. So in flying missiles or secondary missiles, you will see Marshall's triad. So Marshall triad. Tertiary because of victim displacement. So tertiary because of the victim displacement. Quaternary because of structural damage. So because of the blast, there can be electrocution, there can be traumatic asphyxia and death. So the quinary is because of the radiation. So this is very important. Can be asked in your exam. Okay. So Nishchay Gangavar. Okay, I'll help you. Don't worry. Nishchay Gangavar. Okay. Now one more question asked. What is the common organ involved in underwater blast? Can anyone answer? Underwater blast and solid blast. Solid blast. Let's see who is going to answer. Yes, underwater blast. Underwater blast, it is intestine. Solid blast, skeletal fracture, skeletal injuries. And I think one of the student asked me Nishchay Gangavar. So Nishchay Gangavar, so say example, this is the firearm injury. So say example, this is firearm and this is the skull. So in case of entry wound, there will be inner table beveling. So inner table will be more damaged. In case of exit wound, outer table is damaged more. That is known as outer table beveling. So beveling means removal. So if more inner table is removed, that is entry wound. If more outer table is removed, that is known as exit wound. Look at this. This is a firearm. This is the entry wound. In this entry wound, there will be inner table beveling because inner table is unsupported. The skull has inner table and outer table. So when inner table is unsupported, that leads to inner table beveling. Okay. So this is how you can remember. So is it clear? Is it clear? Okay, good. So Nishchay Gangavar. Okay, chalo. So this is okay. Blast injury is commonly asked. Now what is this actually? This is a case of blast injury. image can be asked. So what we can see here, punctate abrasion, punctate laceration, punctate bruises. What is this image based question? So I am covering here there some image based questions you need to memorize for better understanding. So this is the case of blast injury where you will see Marshall triad. So my question is, what is the type of blast injury here? Primary, secondary, tertiary, quaternary, quinary. Come on guys. Come on guys. So this is Marshall triad you said. So that is secondary blast injury. Secondary blast injury. Why? Because of flying missiles. Because of the secondary projectiles, moving projectiles, because of the blast wave. So blast wave can be unidirectional, bidirectional, multidirectional. So it can lead to flying projectiles, and flying projectile will cause some injuries over the body. Marshall triad. Good. Many answered. That's great. Fine. So now next heading is torture method. Frequently asked. Favorite of NEET PG. NEET PG torture method commonly asked. Commonly asked. Okay. So now look at this torture method. Like this, beating on the palm and sole, beating on the palm and sole. What is that known as? Right, come on guys, come on. So bit. Okay, this is known as phalanga. Phalanga. So answer is phalanga, correct answer. So now look at these 4 images. So this is parrot perch. So this is parrot perch, where the hands and legs, upper limb and lower limbs, are suspended to the pole there in a prone position. So this is the prone position. So prone position. This is known as parrot perch. This is dry submarine. The image you can see there, dry submarine. And this is Gotna. So the Gotna means placing a wooden pole over the thighs and walking over it. That leads to intense pain and the pressure. Intense pain. So that leads to confession in some time. Gotna. All these are commonly asked. And also question can be asked: wet submarine, plankton, okay, black slave. All these are commonly asked question in exam. No. Yes. Okay. Phalanga. Fine. So look at this now. Torture methods. Can I identify all the torture methods here? I'll just give you the ABCD. You need to identify A, B, C, D, and E. Let's see who is going to answer. Frequently asked. That's why try to memorize this. Try to memorize this. Come on. Let's see who is going to answer. I'm just waiting. All of you just interact with me. You are naughty dog. Acha, okay, doctor. So this is parrot perch. So this is phalanga. What is this then? This is dry submarine. This is wet submarine. So what about the C? I think C nobody has answered. C. What is the C? C. No, it is not plankton. Not plankton. C is La Bandera. La Bandera at the level of wrist. Suspension at the level of wrist. There is something known as D. Murcielago, that is at the level of ankle. So all these are commonly asked. Remember Tokyo Declaration. Tokyo Declaration, that is equal to torture. Tokyo Declaration by World Medical Association, that is equal to torture. All these are frequently asked. Okay, good. So all these are given there. You can see here Chepua. So almost same only. Gotna and this almost same. Legs and thighs are tied very tightly with the bamboo sticks to induce severe pain. But here in Gotna, no, the policeman standing on it. The policeman standing on it, that is in case of Gotna. Sham execution, dunking, declaration of Tokyo, all is one liners given in workbook. You can just download after the class and go through all the topics frequently asked in the exam. So telephone or beating on the ear like this. Okay. Okay. Next. Now I have a forensic mystery question now. Very interesting question. Joseph Merrick, also known as Elephant Man, died at the age of 27 while sleeping in lying down position. He was suffering from neurofibromatosis. He was suffering from Proteus syndrome. In neurofibromatosis and Proteus syndrome, Proteus syndrome there will be soft tissue growth. So the head enlarges, the head weight increases. So normally he used to sleep in sitting position only. One day he tried to sleep on normal lying down position and he died. So he died while sleeping in lying down position. So my question is, what is the probable cause of death? What is the probable cause of death? So very interesting question. So just to make the forensic interesting here there. Elephant Man, Joseph Merrick. Can anyone answer what is the type of asphyxia there? Adi, Pinaka Ghosh, Exportin. So the probable cause of death can be positional asphyxia. So either it can be positional asphyxia or cervical vertebra fracture. Cervical vertebra fracture. Cervical vertebra fracture. Good answer. Good answer. Many answered correctly. Good. So next is the heat stroke. Heat stroke, very simple question. Heat stroke, sunstroke, pointed hemorrhage, all these are causes of postmortem caloricity. Postmortem caloricity. Impaired consciousness because of involvement of the higher centers of the brain. That is true. Cerebral dysfunction, that is true. Core temperature, that is true. So answer is sweating is absent. So very simple. The heat stroke is also cause for postmortem caloricity. Postmortem caloricity. So postmortem caloricity frequently asked in the exam. So what happens? Body temperature rises for about 1 to 2 hours after death. The causes can be septicemia, strychnine poison, tetanus poisoning, heat stroke, sunstroke and all, pointed hemorrhage as well. So and one more question asked commonly is, what are the conditions seen in hypothermia? What are two syndromes seen in hypothermia? Extreme hypothermia. There are two syndromes. They can be seen in case of extreme hypothermia. Let's see who is going to answer. Good, good. So come on, try all of you, try. Yes, very good. So many students answered paradoxical undressing. Paradoxical undressing. So sometime it is confused with rape. Rape. Second, hide and die syndrome. Hide and die syndrome. So the person might die because of suffocation. So two syndrome, paradoxical undressing and hide and die syndrome. Both are commonly asked in the exam. Good. So that's fine, that's okay. Chalo. So next is the rule of 9. So very simple rule of 9. Rule of 9 is frequently asked in NEET PG, but you need to memorize properly. Now let's see how many of you are going to answer this question. A 30-year-old married female presented with a bone injuries involving entire abdomen, both the lower limb, percentage of bone injuries as per rule of 9. 54, 27, 68, 90. Entire abdomen. Entire abdomen. that is front and back both, front and back both lower limb, both lower limb. Come on, try to answer. Enter abdomen means what? 18, both lower limb, 18 plus 18, that means it is 54. The answer is 54. 54 is correct answer. I think many answered B, so don't be confused, it's 54. Okay, try to memorize this. Head and neck area 9%, arm 9%, front is 18%, that is the trunk, back is 18%, genital area 1%, leg is 18%. This is important, this is the area of confusion, this is the area of confusion. So it's 54, correct answer. So, and in children we use LB formula, and one more method is Palmer rule. So Palmer rule. So the question can be asked about what is the surest sign of antemortem, surest sign of antemortem bone injury. Can anyone answer? Antemortem, that means the person was alive at the time of incident. Antemortem bone injury. So your answer should be smooth particles. The question can be asked about heat artifacts. Heat artifacts, especially heat fractures, heat hematoma, and heat rupture. So remember, heat artifacts are basically postmortem findings. Okay, so heat fracture commonly seen over the both the sides of the vault. Heat hematoma commonly resemble like extradural hematoma, but it is bilateral. Heat rupture, in heat rupture normally you will see intact vessels and the nerves, but in case of laceration there will be no intact and nerves and the vessels. So this can be asked in your exam, heat artifacts. Yes, smooth particles, that's great. Now specific finding in antemortem bones. Heat hematoma, heat fracture, futuristic at line of redness. It can be antemortem or it can be postmortem. So this is basically postmortem. Heat fracture also basically postmortem. So the answer is line of redness. So line of redness, blisters containing protein, then smooth particles, signs of inflammation, pus formation, carboxyhemoglobin. So all these are the features of antemortem bone injuries. Antemortem bone injuries can be asked in your exam. Yes, D is the answer. Very good, many answered. Now look at this. What is this attitude known as? What is this attitude known as? Like a boxing attitude, because of the denaturation of proteins of the muscles, because of the high heat, and heat level is more than 70 degrees Celsius. What is this known as? Yes, come on, try all of you. Try. So this is known as pugilistic attitude. This can be antemortem or postmortem. It has no medical legal significance. It commonly occurs at the temperature more than 70 degrees Celsius. Good. Now look at this. There are two images there. Image number 1 and image number 2. What are these findings? And also we will see one more image there. 3 findings are there. So this is a case of burn injury. So in forensic medicine department, so we are in the autopsy room now. So while examining the hands, so I found there are blisters are there with the protein, and there is one more finding that is true. And what is this actually? There are 3 findings there. What are these? So these are antemortem blisters. Antemortem blisters. So this is tattoo mark, and this is a line of redness. So line of redness are signs of inflammation. So this go in favor of antemortem burn injury. Antemortem burn injury. And in exam NEET PG very frequently asked, when tattoo mark is invisible during autopsy, when tattoo mark is invisible, you need to dissect the lymph node. You need to dissect the lymph node. So this can be asked in your exam. Tattoo again commonly asked. Okay, tattoo, fine. Now look at this. There is a tattoo over. Interesting question. Just to make you interesting, just to make you happy there. So there is a tattoo, bluebird sign. So this is the bluebird sign. So a tattoo can show you the religion, can also show you some sexual paraphilia or mental status of the person. So bluebird sign at the skin between thumb and the other finger, index finger. What is this known as? What is this basically? What is the sexual paraphilia in this bluebird sign? Let's see who is going to answer. Let's see who is going to answer. Come on, try. Come on, try. Homosexuality, very good. So it's probably homosexuality. Homosexuality. So homosexuality can be sodomy. Second one, lesbianism. Lesbianism. Sodomy, is it punishable? Is it punishable? Can anyone answer? Sodomy, that is anal intercourse. Is it punishable offence in India? It was punishable under 377 IPC. Now it is not punishable. Not now. Not now. Very good. Not now. So lesbianism can be asked, female homosexuality. And in lesbianism, one more commonly asked in NEET PG, active partner, the passive partner. So what is the name given to active partner? What is the name given to passive partner in lesbianism? Try. Asked in NEET PG. Active partner is known as Suvankar, Atropine, Bharadwaj, you are naughty doctor, Bharadwaj Dasari, Adi, Nishchay. What is the name given to active partner in case of lesbianism? Options are Femme, Buch, Dyke, Ketamite. Suvankar. Active partner is known as Buch or Dyke. Passive partner known as Femme. So passive partner in sodomy, Ketamite. Ketamite. Habitual passive agent known as Ketamite. Okay, Ketamite. Okay, chalo. Ketamite is the question asked in one of the university exam. I remember Ketamite was the question asked. Actual answer is habitual passive agent. He wrote in detail about cat, types of cat, what are the diseases caused by the cat, and he wrote in detail about mite, what are diseases caused by mite, scrub typus and all. One page has written. So Ketamite is habitual passive agent in case of sodomy. So very funny answer given by one of the student. Okay, so some answers are really funny. Okay, some answers in professional exam really funny. I remember one more answer given by one of the student. Testamentary capacity. The question asked about testamentary capacity. Do you know what is testamentary capacity? Do you know what is testamentary capacity? See, testamentary capacity that comes in forensic psychiatry, it is ability of the person to make valid will. It is the mental ability of the person to make valid will. So any person more than 18 year, major, conscious person, oriented person without any delirium can make valid will about his properties and property rights and all. And living will also, living will that is related to treatment. So that is testamentary capacity. Okay. Then what he wrote in exam testamentary capacity, he has written some half page in the exam. So testamentary capacity is the ability of the person to produce children. He thought testis and he mentioned it is the ability of the person to produce children. It increases during evening time and it increases in winter season, cold season and all. He has written half page has written testis capacity to produce children. Imagine about our professor and the kind of depression we are undergoing while correcting the papers of forensic medicine. So okay, so it's not easy. So very funny answer given by him. Testamentary capacity. So remember two MCQs. Testamentary capacity is the ability of the person to make valid will. Living will is basically it is the statement given by the person who is undergoing treatment about his future treatment option when he is unconscious or when he is not in the position to make valid decision. Living will is also asked. Okay, yes, that's okay, that's fine. So oh, you are a friend. Okay, fine. Mr. Vartas must be your friend. Good. Chalo. What is this now? Now see, I am in the autopsy room now. I am forensic expert there in the autopsy room. This is a lung. So lung and cut section of lung. So there is something clearly visible. What is this finding? So the police officer is asking me, sir, whether it is antemortem or postmortem. So what should be my answer by looking at this image of lung in autopsy room? Yes, come on. Come on, try. So this is basically soot particles in the lung that is showing antemortem bone injuries. Good. So next question is about the postmortem staining. So as you know, postmortem staining is dependent of blood in the dependent body parts. So the question is cause of death in below case. So here cherry red spot, very frequently asked, cherry red. Okay. So what is the answer? Cherry red. You can see here clearly visible. So what is this basically? So you can see the contact pallor there. So this is the contact pallor. So this is cherry red spot, cherry red. You can also see here distinct margin. So distinct margin. So this is postmortem hypostasis. So this is not the bruise. So bruise doesn't have distinct margin. So what is the answer? The answer is carbon monoxide. Cherry red. Hydrogen sulfide green color. Yellow phosphorus yellow color or brown color. Opium black color. The question asked in NEET PG exam, smoking stool syndrome. Can anyone answer? Smoking stool syndrome caused by? Smoking stool syndrome is a disease or a poisoning caused by dash poisonous agent. So yellow dirty fellow. Can you answer, all of you? Yellow dirty fellow. What is the answer, all of you? Smoking stool syndrome. Come on guys, come on. Answer is yellow phosphorus. Yellow phosphorus. So because yellow phosphorus also known as white phosphorus, it is poisonous. It leads to phossy jaw. It leads to liver disease. liver necrosis. Red phosphorus is non-poisonous. Red phosphorus is non-poisonous. That is also asked in the exam. So opium means morphine. Okay, good. Now this is what given in your notes. You can go through this. Can anyone answer chocolate color? Chocolate. So one who answer will get chocolate for me. 3D chocolate for me. Chocolate color. Let's see who is going to answer. Shiva Prasad, 3D chocolate. One who answer will get 3D chocolate for me. Come on, try. Yes, very good. So basically it is nitrate. Good answer. Good. So chocolate color, you can see here, it is aniline and nitrates. Okay, no problem. I think Adi, just remind me at the end. I'll just discuss about this. Adi, I'll definitely answer. Don't worry. We are there to help you. Yes, good. So now we have some sections about rape. Already we discussed rape. Rape is defined under section of BNS. Rape defined under 63. 64, punishment. So try to memorize. Dowry death. 116, grievous hurt. So the answer is 63. Okay. So legal age for consent is 18 years. Statutory rape and all we discussed, right? Chalo. Okay, this is all we discussed. Look at this image. Try to memorize. Gore agata karna, section 116 BNS. That means grievous hurt. That means it is emasculation, permanent privation of sight of either eye, permanent privation of hearing of either ear, privation of member or joint, privation or loss of power of member or joint, disfiguration of face, fracture dislocation of teeth or bone. Last one, any act leading to severe bodily pain, endangering life, and person is unable to do ordinary pursuit for about 15 days. So this is 116 BNS. 116 BNS. Gore agata karna, grievous hurt. Okay, grievous hurt. So all of you okay? Are you enjoying forensic class, or am I inflicting some grievous hurt on your mind? Gore agat, forensic medicine. Is it so? Is it interesting? Are you enjoying class? How is the Josh in forensic class? It should be high in all the time. It should be very high. So last moment, so marathon session, your Josh should be very high. You should have courage to learn some new things at the last moment from the teachers, some updates, especially BNS and all. It should be high. So all of you students, how is the Josh in forensic class? Are you enjoying? Say yes or no. Yes or no, guys. Interesting. Okay, you are enjoying. That's great. That's fine. Chalo. Okay, very high. Good. Now I have a question for you. So identify sexual perversion given below. So here, so he is the male basically. So male or female, don't worry. He gets sexual pleasure. So by beating, or by inflicting pain, or any defeating condition, even not only the beating, even harassment from the partner, he gets sexual gratification. So what is this known as? So this is known as masochism. So sadism is giving pain. So giving pain. Sadist means giving pain. So sometime it associated with lust murder. Lust murder. Sometime associated with necrophilia. Necrophagia. So necrophilia, necrophagia, 301 BNS. So write this in chat box. Necrophilia means having intercourse with dead. Necrophagia means having dead body parts as a food can lead to sexual pleasure. 301 BNS. All of you write this in chat box. Necrophilia, necrophagia is equal to 301 BNS. Acha. Okay, some new Nisha is telling masochism means macho ko dard nahi. Okay, macho ko basically masok. He was the writer. He used to get sexual pleasure, and he used to get stimulus to write books. He was very famous writer. He used to get stimulus to write book by taking pain from the partner, from the wife. So repeated wife scoldings and beating from the wife, he used to get sexual pleasure as well as stimulus to write the book. That is masochism basically. Okay. So okay, sadism is opposite, giving pain, that is. Okay, necrophilia, 01 BNS. Good. Transvestism is also known as eonism. Very commonly asked. Eonism. Known as cross dressing. Cross dressing. Fetichism is with inanimate objects. Very frequently asked. Inanimate objects. Not with the normal objects, inanimate objects. Like example, stealing cloth, stealing female cloth like female sari, bra, petticoat, so innerwear, and keeping it in a room or apartment. I have seen one case, a thief who is fond of all the feminine objects like bra, petticoat and all, and he was arrested by the police one day, and they found hundreds of sari, hundreds of petticoat in his room. So he was basically suffering from fetichism, inanimate objects. Okay, so this is about the necrophilia and all. Now look at this. Now there are two conditions there, A and B. Try to identify what is this. Very simple actually. Very simple. A and B. Try to memorize. Come on, try. So A is transvestism. So B is fetichism. Good. So the question can be asked about cisvestism. Cisvestism. Cisvestism means inappropriate clothing in public place. Okay. So that is known as cisvestism, fetichism. Good. Now look at this. Okay, this is the table that is given there. You can just go through this. Sadism, masochism, bondage, fetichism, pratyurism, exhibitionism, transvestism, uranism, buccal coitus, a sin of Gomro, voyeurism, troilism. So all these are very, very important. So very, very important NEET PG question. Sexual paraphilia, sexual perversions, abnormal sexual behavior. Abnormal sexual behavior. Just go through this after the class. Chalo. Now look at this interesting question. So this something very common sexual paraphilia. So where a male captures the image or the video of the female while using lavatory or while doing some private act, while changing dress in a mall or while using lavatory or the toilet. So here Y secretly installed a hidden camera in the bathroom of his female tenant without her knowledge. The camera captured images of X while she was using bathroom, a place where she had reasonable expectation of privacy. Y then shared these images with her friends through the messaging app. It is punishable under. What is this now basically known as? So this is this question somewhat related to the movie Drishyam movie, one of the nice movie. So have you seen this movie, guys? Have you seen this movie? The first part, Drishyam one part, where villain captures the image, the video of the female while using lavatory or changing dress, and that he will use as a weapon of blackmailing. Have you seen that movie? Yes. Okay. So this is something related to that. This is known as peeping tom. So this is known as peeping tom. Peeping tom, also known as voyeurism. So voyeurism, and the question is under which section it is punishable. So the answer is 77 BNS. I remember voyeur is equal to 77 times. Voyeur 77 times. Voyeur is a name, and he is doing the same crime repeatedly. How many times? 77 times. That's why he is sexually perverted. He is having sexual paraphilia. Okay, voyeur 77 times. You can remember like that. Okay, chalo, good. Acha, okay. In Tamil. Okay, good. It is there in Tamil, Telugu, Kannada, Hindi, all the languages. I think original movie in Malayalam. Okay, then it is dubbed in other languages. So this is voyeurism. 301 I said necrophilia, necrophagia. 63 is definition of rape. 64 is punishment for rape. Good. Yes, good. Joe, that's fine. Now, okay. Good. Okay, all of you understood? Okay, that's fine. So next question, I have one more interesting question for you. Look at this very interesting question. A 20-year-old female brings her boyfriend. So boyfriend is having some sexual perversion. She is uncomfortable. She is totally uncomfortable with the behavior of the boyfriend. She is not happy. She is not enjoying. She found him clutching her feet during intercourse. Notice that he insists on being able to see her feet while they engage in sexual act. So he insists to see her feet. What is this basically? So feet. What is this basically? Can it be exhibitionism? No. Exhibitionism can be mooning. It can be anarisma. It can be flashing. It can be streaking. Streaking means running naked. So masochism, I said already, taking pain. Fetichism, I said already. So what is the best answer? Transvestism, no. So what is the best answer then? So this is a type of fetichism. So this is the type of fetichism. So this can be asked in your exam, fetichism. Good. Okay. So this is about the, so mooning means showing buttocks in the public place. Anarisma, lifting skirt in the public place. Flashing, showing genitals. Streaking, running naked. All is a type of exhibitionism. Okay. Good. Now I have a question for you. Okay. In case of rape, woman states in her evidence before the court that she didn't consent. The court shall presume that she didn't consent. So the court will accept that she didn't consent. So even in case of sex worker, even in case of sexual worker or the prostitutes. So the consent is very important in case of sexual intercourse. When consent is not there, it is equal to rape. So it is true or false? True or false? So what is your opinion? So what's your opinion? Come on guys, come on, try. Come on. What do you think? Yes, very good. A Ram, Ram, very good. Gangavar, very good. So it is a true statement as per 120 BSA. So as per 120 BSA, so the court will presume that she did not consent. And remember, entire proceeding will take place in camera. In camera. True. True it is. Good. Good. Many answer. Remember 120 BSA. It is 120 BSA. This can be MCQ. So 120 BSA is presumption of consent. Write this 120 BSA is equal to presumption of consent. Presumption of consent. Write this in chat box. All of you please write in chat box. Write this in chat box. All of you write. Yes, good. Suvankar, very good. Suvankar, and these points are not there in any textbook. And I think any of the other classes I feel 120 BSA, 120 BSA presumption of consent, good. Nishavar, very good. Adi, very good. MP Virtus, very good. So all of you keep writing few points. Shiv Prasad Rentala, very good. Good. So 1 time rating is equal to 10 time reading. Who knows, this might come in exam. So directly the answer 120 BSA, not BNS, BSA, BSA. So Bharatiya Saksha Adhiniyama is not BSA, it's BSA. Good. Good, good. Chalo. Good. BSA. That's great. Sanjeev Ram, good. Now I have a question for you, and the question is about seminal stain and blood stain. So we are talking about a blood stain now. So the first is blood stain. Very commonly asked, all of you concentrate. Frequently asked in the exam, blood stain. So blood stain, there are certain tests known as presumptive test. So presumptive test and confirmatory test. And confirmatory. Presumptive and confirmatory. Presumptive tests are so benzidine, tetramethyl benzidine, lugal iodine, okay. Then it can be orthotolidine. So it is orthotolidine, not lugal iodine. Okay, orthotolidine, tetramethyl benzidine, phenolphthalein. So all these are the tests for blood stain, presumptive test. They are not confirmatory test. So hemoglobin has peroxidase activity. It gives to different color with the different test. So all these are presumptive test. Confirmatory test, Takayama test and Teichmann test. Now look at this Takayama. This is Takayama test. So Takayama test, you will see hemochromogen crystals. So the crystals are pink feathery crystals. I remember like this. Takayama is there, no? Takayama. I remember Mama. You know, Mama is very important in everybody's life. Mama, and all. So I remember pink Mama with the feather. I think it looks funny. Pink Mama, Takayama. So it is pink feathery crystals. Basically test for blood stain. Yeah. Good. So good. Teichmann test, I remember brown man. So brown man that is brown rhombic crystals. So brown rhombic crystals. Okay. Yes, Gurum, it is a Kannada word. Mama, Mahava, and all, it's Kannada word. So yes, Teekman is basically hemin crystals, brown rhombic crystals. Takayama basically pink mama. So I think you can remember, no, pink mama, brown man. Man means teak man. That is hemin crystals, brown rhombic crystals. Pink feathery crystals, that is equal to Takayama test. Done it is. So this is okay. So pink mama, do you remember, all of you guys? Pink mama. Okay. Now seminal stain. Seminal stain. Seminal stain. In seminal stain, very commonly asked question is Barberio test. Barberio test. In Barberio, you will see yellow needle shaped crystals because of the spermine picrate. Spermine picrate. So how do I remember barber shop? Yellow dirty fellow. Barber shop. Yellow dirty fellow. Barber is a dirty fellow. I remember like that. Something like that. You can remember like that. Spermine picrate. Florence. So Florence. So basically choline iodide crystals with a dark brown rhombic crystals. Dark brown rhombic crystals. So in Florence, the size is little more. So more than the Teekman test in case of RBC. So there are 4 commonly asked tests: Teekman, Takayama, Barberio, Florence. Yes, good. So this is very important, very commonly asked in the exam. Very commonly asked in the exam, guys. Come on, guys. Are you getting my point? I hope this question will come in exam. So I'll repeat again. Blood stains are classified into, blood stain tests are classified into presumptive test. The presumptive test, the principle is hemoglobin has peroxidase activity. It reacts with the reagent, it gives us different color. So benzidine gives rise to blue color, tetralmethylbenzidine gives rise to blue color, orthotolidine gives rise to blue color, phenolphthalein gives rise to that is pink color. P for phenolphthalein, P for pink color. Confirmatory, we have Teekman and Takayama. Teekman, brown rhombic crystals. So Takayama, mama, pink feathery crystals. Seminal stains, we have 2 important tests, Barberio. So Barberio test because of spermine picrate and Florence because of the choline iodide. So Florence will detect prostatic secretion. Prostatic secretion. And Barberio will detect seminal fluid, seminal vesicle secretion. Seminal vesicle secretion. Okay, so these are all very commonly asked in the exam. Good. So this is about the test. Okay, all of you okay, understood? Any doubt in this? What is the commonest test used in blood stain? What is the commonest presumptive test? Can anyone answer? Dr. Sabha, Shivprasad. What is the commonest test? Gurum, Joe. What is the commonest blood stain test? Let's see who is going to answer. Options are benzidine, tetramethylbenzidine, phenolphthalein, orthotolidine. Benzidine, no. Benzidine is now bladder cancer. It leads to bladder cancer. No, it is not used. It's not benzidine. Not benzidine. Not orthotolidine. Not orthotolidine. Let's see who is going to answer. No, not orthotolidine. Sanjeev Ram, no. We call it as Castle-Meyer test. Very good. It's a phenolphthalein test. Very good. So answer is Castle-Meyer test. Castle-Meyer test. That is phenolphthalein test. Phenolphthalein test is the commonest test. Commonest test, phenolphthalein. Good. And in case of seminal stain, we use Christmas staining. Confirmatory is Christmas staining. Christmas staining, gram staining you can use. Okay. You can also use fish technique, fluorescent in situ hybrid technique. Okay. Fish technique also use Christmas staining and all. So answer is Christmas staining. That's great. Okay. This is about seminal stain. Okay. Next, some questions about ossification centers appears at 7 months. 7 months. So this is one more very interesting topic, very commonly asked. Lower end of femur, talus, calcaneum, upper end of tibia. So in 7 months, the answer is talus. Answer is talus. You can see here, calcaneum and manubrum sternum 5th week, talus 7th month, lower end of femur 36 week, upper end of tibia 38 week, cuboid 10th month. Cuboid 10th month. So this is also very, very important. The commonly asked is carpal bones as well. So carpal bones. Carpal bones. So frequently asked in exam. So what are the carpal bones? So the first two appear is capitate. So capitate. Then comes is hamate. Next comes is triquetral, trapezium, trapezoid. Okay. So we have scaphoid also. We have scaphoid. So 1, 2, 3, 4, 5, 6. Lunate also. We have lunate. And we have fusiform. Fusiform. So frequently asked in the exam. Can anyone answer when capitate appears? When capitate appears? Capitate. Yes, try capitate. So capitate, remember capital. Capital means largest carpal bone. So it's the largest carpal bone. 2 months. Hamate also 2 months. So capitate, hamate, they are very good friends. So capitate is a good friend of hamate, like Dhoni and Jadeja. So remember Dhoni and Jadeja. Dhoni and Jadeja. So basically capitate and hamate. So 2 months. 2 months. Okay. Triquetral 3 years. 3 years. Trapezium, trapezoid, they are also very good friends. 5 to 6 year. 5 to 6 year. So Dhoni Jadeja, Dhoni Raina, trapezium, trapezoid, 5 to 6 year. Scaphoid, yes, is there, 5 year. Lunate, 4 year. Fusiform, 9 to 11 year. 9 to 11 year. Yes, CSK fan. Okay. I am fan of all the teams, not CSK, RB, RCB also. Any good player I do like. So Dhoni Jadeja, okay. Anyway, you can remember Dhoni Jadeja, capitate, hamate. Dhoni Raina, trapezium, trapezoid. So we have 2 friends here. Dhoni Jadeja, capitate, hamate, 2 months. Trapezium, trapezoid, basically that is Dhoni and Raina. You can remember like that. Okay. So this is very common here. When do they fuse? When do they fuse? Can anyone answer? When do carpal bone fuse? When do carpal bone fuse? I said about appearance. Capitate 2 months, hamate 2 months, triquetral 3 years, scaphoid 5 years, lunate moon shaped bone 4 years, fusiform small bean shaped bone 9 to 11 year, trapezium trapezoid 5 to 6 year, My question, when do they fuse? Come on, come on. When do they fuse? Come on. Yes, anyone, can you answer? Come on, try. 12 years. No, it is not 12 years. It is not 12 years. Come on, guys. Give logical answer. Logical answer. Logical answer. Logical answer. Come on. They never fuse. The answer is they never fuse. So carpal bone never fuse. So answer is never fuse. Carpal bone, they just appear. They present in the carpal area. They never fuse with any other bone. Okay, answer is never fuse. Good. Now we have some centers of elbow as well. Elbow joint. Again, commonly asked in the exam. So mnemonic is 𝐒𝐿2. 𝐒𝐿2. Mnemonic is 𝐒𝐿2. C for capitulum. Okay. C for capitulum. R for radius. I for inner epicondyle. T for trochlea. O for olecranon. E for external epicondyle. Commonly asked. So capitulum, that is 1 year, 3, 5, 7, 9 and 11. 1, 3, 5, 7, 9, 11. All odd numbers. So all of you write in the chat box. 𝐒𝐿2 is equal to 1, 3, 5, 7, 9, 11. In chat box you write. Write this in chat box. 𝐒𝐿2 is equal to 1, 3, 5, 7, 9, 11. There are some variations actually, but this is one easy mnemonic to remember. Write this in chat box. Nishchay. Okay. For 18 years, wrist joint is commonly done. Wrist joint. Yes, come on, try. 𝐒𝐿2 is equal to Sajid Kumar. All of you write. This is very important topic. Very important topic. So keep writing. Sajid Kumar, atropine. Sajid Kumar, wrist and shoulder for 18 years. Yes. 𝐒𝐿2. Yes. 𝐒𝐿2. 1, 3, 4, 7, 9. Good. Chalo. Good. Now I have a question here. Now, which is the best suture for age estimation? We have sagittal suture. You can see here. We have sagittal suture, and we have coronal suture, and we have temporal suture, and we have lambda suture. What is the best suture among these suture for age estimation? What is the best suture for age estimation? Yes, come on, guys. So Sajid Kumar, very good. It is basically it is sagittal suture. Very good. Answer is sagittal suture. Good. Next I'll skip. Next comes is our insanity. So forensic psychiatry, few questions. Features of true insanity, all except. True insanity means schizophrenia, bipolar disease, mania, depressive psychosis. All is a true insanity. Except, so here is the schizophrenic patient. You can see here this man schizophrenia, having delusions, hallucinations, and third person hallucinations, disorganized speech, disorganized behavior. So and avolition. So he has basically all major symptoms of schizophrenia, delusions and all. So what is the best answer? So gradual onset, yes. Presence of delusion, yes. Fear of detection, no. Insight is impaired, yes. So answer is C is the correct answer. So fear of detection is common in case of feigned insanity, not in the true insanity. Okay. So schizophrenia very commonly as topic. Anyway, that we are going to discuss in psychiatry. You can go through that. So most common delusion is delusion of persecution. Most common hallucination is third person hallucination. So there are 5 important DSM criteria. So one is the delusion, hallucination, disorganized speech, disorganized behavior, and avolition, lack of expression and all. Okay. So this is about the insanity, true insanity and feigned insanity. So this is notes given there. You can just go through that. Go through that. I think it is clear, easy. Yes. Next. All are examples of psychosis except psychosis. Psychosis means insight is absent. Insight is absent. Simple question. So answer is obsessive compulsive disorder. So OCD is well known as neurosis. So OCD well known as neurosis. So 17, what is the answer? 17. So that is obsessive compulsive disorder, OCD. Good. Again the differences given there, psychosis and neurosis in the workbook. So judgment, insight, personality, contact with reality absent in psychosis, present in neurosis. Delusion, hallucination common in psychosis, usually not present in neurosis. Examples: schizophrenia, delusional disorder, mood disorder, mania, depression, bipolar disease. Here phobia, disorder, conversion disorder, OCD, anxiety and all. So yes, so this is okay. Shall I skip this, guys? Shall I skip this? Can you go through this after the class? Say yes or no. Reset, restart, atropine, Sanjeev Ram. Come on, come on. Okay, Rentala, fine. Now we'll have some discussion of delusions. Now this is just to make you happy, okay? See, me having one delusion. Imagine I don't have any delusion. So I have delusion. Delusion about Deepika Padukone. So one of my favorite actors is Deepika Padukone. So sometime I feel that Deepika Padukone is in deep love with me. See, I am in love with her, that is normal. But here I think she is in love with me, though I never met her. I never met her in my life, but I think she is in deep love with me. So Deepika Padukone मुझसे बहुत प्यार करती है, हालांकि उनसे कभी नहीं मिला. या किस प्रकार का भ्रम है? Can anyone answer? Just to make you grandiosity. What do you think? Is it grandiosity or what it is? Come on, dry. No, it is not grandiosity. Grandiosity is seen in case of mania. है ना? So delusion of grandeur, where person thinks that he is powerful, beautiful, something like that. Okay. What is this known as? Yes, come on, guys. Is it Othello syndrome? No, it is not Othello syndrome. What is this known as? I think the first to answer by Shubham Joshi. Shubham Joshi, this is known as erotomania. Erotomania, known as de Clerambault syndrome. De Clerambault syndrome. Excellent answer. Erotomania, de Clerambault syndrome. It's common in females. It's a delusional disorder common in females. Okay, so answer is delusion of love or erotomania, also known as fantasy lover syndrome. Good answer, fantasy lover syndrome. What is Othello syndrome? I think some student answers are Othello syndrome. So Othello syndrome is basically a syndrome of pathological jealousy. So pathological jealousy towards the partner. Othello syndrome. Okay, morbid jealousy. So infidelity. So good. So this is okay, interesting. Now you want me to discuss one more thing? So now I have one more delusion now. One more delusion. Identify the type of delusion where unfamiliar people are mistaken for someone you know. Unfamiliar, stranger person mistaken for someone you know. Like a beggar mistaken for your boss. So, beggar here. So, he is beggar, unfamiliar person. For me, he looks like a Donald Trump, my boss. Something related to the forensic psychiatry delusion. So, what is this basically known as? What is this syndrome known as? Very interesting. You just interact with me for better understanding. And one more delusion I have. Someone you know is perceived as imposter duplicate. He is basically Trump. I know him very well, but since few days I am feeling that he is Donald Trump. He is not Donald Trump. He is someone stranger. He is someone stranger or in disguise, or he is an imposter. So what are these two syndromes known as? These two delusions. So unfamiliar people mistaken for someone you know, beggar with a Donald Trump, or Donald Trump with a stranger person. So very interesting Donald Trump stories are there now. Come on guys, come on, try. What are these syndrome? Yes. So look at this. When stranger considered as a familiar person, that is known as Frigoli person. Frigoli syndrome. Capgras syndrome is when a familiar person considers stranger person. So what is the answer then? What is the answer for A and B now? Look at this answer. Capgras and Frigoli. Capgras and Frigoli. A person standing in front of you saying he is your brother, but you don't believe him. Stranger considers a familiar person, a beggar standing in front of you, but you think he is your boss. Sir, F for Faltu. Faltu will be familiar. Acha. Okay, very good. So I think Faltu will be familiar. So this is Frigoli then. Yeah, this is Frigoli. Frigoli, Faltu. So Faltu people mistaken for familiar person, right? What it is? Goli. Familiar person is giving Goli. That's okay. Capgras syndrome. That's fine. Now, next question is from forensic medicine. That is age estimation. Cephalic index of skull is used to estimate. Very simple question. Cephalic index is equal to breadth of the skull divided by length of the skull. So multiplied by 100. So the cephalic index classified into dolichocephaly, dolicho, mesati, or brachycephaly. So brachy. So dolicho means 70, 75, 75 to 80, brachy more than 80. So dolichocephaly. So blacks are Native Americans. So Native Americans, mesati, Europeans, brachy, Mongolians. Good. So in India, cephalic index is basically 75 to 80. So the answer is race. So mesati, mice, Indian and Chinese. Okay, Indian, Chinese and okay, Indian, Chinese and okay. You can remember mice also mnemonic. MIC, M for mesati. So I for Indians, you can remember like that. C for Chinese and Europeans. Okay, mice is the mnemonic. So Dr. Deepak answering very well. Dr. Deepak, good answer. Good. Now I have a question, NEET PG question. Anterior posterior diameter is maximum in. Anterior posterior diameter is maximum in. NEET PG question. Max in. So what is the best answer? What is the best answer? Break the mango. Okay, brachycephalic, break the mango. Okay, good. Can anyone answer? Debake, can you answer? Dr. Debake? Interpostal diameter is maximum in. So answer is dolicho. Enter dolicho. So this is asked in your exam. Fine. Next, very important question. What are the features of male skull except? Can you try, all of you? Can you try? What are the features of male skull except? Rectangular orbits, prominent supraorbital margin, forehead is steeper, prominent parietal eminence. So look at this now. This is the male skull. This is the male skull. You can see there. So all of you say hello to him. Say hello to him, all of you. Say hello to him. Hello. Say hello, hello, guys. He is a 40-year-old male. Say hello to him. So real skull. You can see the real skull there. Hello. Shiv Prasad, say hello. Shreya, just say hi, hello to him. He is helping us. Hello skull. Hello male skull. You can just tell hello male skull. Okay. So look at this skull. Steeper forehead. So in case of males, it is steeper forehead. And look at the orbits. The orbits are basically rectangular. Orbits are basically rectangular. So it's heavy. So muscle markings are heavy. All are prominent. All are prominent except frontal and parietal eminence. Except frontal parietal eminence, everything is prominent. So look at this. So everything is prominent. Foramen magnum is larger, foramen ovale is larger, stylomastoid foramen is larger. So even everything larger and prominent. Mastoid process, styloid process, everything is prominent in case of male skull, except frontal and parietal eminences. Frontal and parietal eminences. Okay. Okay, why not Debake? You can propose. Okay, chalo. So fine, no problem. So all are features of male skull except. Answer is, what is the best answer? So Chandan Thalla, good, good. Answer is prominent parietal eminence. So D is the answer. I said already. So frontal eminence, parietal eminence prominent in female skull. Okay. So all of you remember like this. Female, F for frontal, F for parietal. I remember parietal. Frontal, parietal, prominent. Yeah, P also looks like prominent. Prominent, है ना? Female, frontal, parietal, prominent. Female, frontal, parietal. So instead of parietal, you can say parietal. Okay, so that is prominent in case of female. Okay. So look at this now. A and B. Identify which is male and which is female. Better understanding. So you are in the crime scene now. You are in a house where 2 dead bodies were found. So a report says that one is male and one is female, and probable age around 60 or 70 age group, found dead in a room which is closed since last 4 years. You were just entering the crime scene along with the police people, and there are 2 skulls like this, saying you hello, hi, how are you, like that. Look at this now. Look at this orbits. So orbits are rectangular, but here what you can see here, oval. So oval, and we can make out some more important features. Look at this mandible. So mandible is U-shaped. Here somewhat here V-shaped, and steeper forehead. Steeper forehead. Straight forehead. Straight forehead. And look at the angle of mandible. So angle of mandible, less obtuse. Less obtuse. So here it is more obtuse. So frontal parietal eminences. Frontal parietal eminences are prominent in B. So what are these actually? A and B, can identify. So this must be male. This must be female. This must be female. So is it clear? So angle of mandible is less obtuse in male, more obtuse in female. That can be MCQ. Okay. Rest all very simple. All are prominent except frontal parietal eminences. Frontal parietal eminences. Can you estimate the age with the skull other than the sutures by looking at the teeth? By looking at the teeth or by examining teeth, is it possible to estimate the age? If so, yes, then what is the method? How to estimate the age from teeth of more than 25 years? So commonly asked in the exam. Okay, anyone, can you answer? Can anyone answer? Last molar, okay, 1725, that's fine. Any other method other than this, molars, premolars and all? What is the method of age estimation? By looking at the changes in the teeth basically, especially in the front teeth, not in the molar teeth, front teeth in case of dead body. There is a method very commonly asked in the exam. What is the method basically? There are teeth man. You can see here, there are teeth here. There are certain teeth are there here. Yes, Buddha. ठीक है, बूढ़ा हो गया. Yes, Pinaka Ghosh, can anyone answer? So one who answer will get chocolate from me. How to estimate the age by using teeth? By histopathology of teeth. Very good, Sanjeev Ram. Sanjeev Ram, excellent answer. It is basically Gustafsson method. Gustafsson's method. So Gustafsson method, favorite of NEET PG. So what are the components? The component mnemonic is script. Script is the mnemonic. So S for secondary dentin, C for cementum opposition, R for root resorption, I for attrition, I, P for periodontosis, T for transferency of root. The best is transferency of root or translucency of root. That is the best criteria among the Gustafsson method. Gustafsson method. I think only one student answered, Sanjeev Ram. Good answer, Gustafsson method. So the best criteria is transferency of root. Second best criteria is secondary dentin. Secondary dentin. Good. So Gustafsson method commonly asked. Next, all are features of female pelvis except. Now one more question asked about the pelvis. Female pelvis and male pelvis. Female pelvis and male pelvis. So all of you, very very important NEET PG question. So concentrate. So NEET PG favorite. Get up man, get up, interact with me, keep interacting with me. Yes, right. All the features female pelvis. In female pelvis, it is true, it is averted. Inlet is okay. Subpubic angle is true. Greater sciatic notch. Inlet is round. That is also true. So greater sciatic notch is false. False. So in case of female, it is shallow and broad. In male, it is narrow and deep. Narrow and deep. So the answer is D. So answer is D. Good. Inlet is heart shaped in male, but in a female it is round, correct. So male it is heart shaped, in female it is oval. What about obturator foramina? Obturator foramina in female, what is the shape of obturator foramina? Obturator foramina. So after the class, you just go through sciatic notch index, Washburn index and other indices that is given in the notes, you must know that. So Washburn index, sciatic notch index. Okay. Triangular, very good. Obstetric foramina is triangular in case of female. So triangular in female. Triangular in female. Good. So look at this image. Subpubic angle is wide in case of female. It is narrow in case of male. Look at the shape here in male. It is heart shaped and it is round here. Look at the obstetric foramina, somewhat triangular here. So look at this. This is very important finding. This is commonly asked in the exam. All foramina round except obturator. Okay. Good. So this is what given in your notes. Just go through this. Male pelvis and female pelvis differences. So very important. Very important, commonly asked in the exam. Okay. Now we have a topic. What is next topic? Can you guess what is the next topic, guys? What is the next topic, guys? What is the next topic? Are you tired? For next half an hour, I'm going to discuss few things. Yes, guys, what is the next topic? Arjun Reddy is the topic. What do you think? Arjun Reddy. Are you ready? Arjun Reddy? Come on, guys. No. Shuprasad, next topic. Negligence. Very good. The next topic is negligence. So negligence can be of two types: civil negligence, criminal negligence. Civil negligence is a minor negligence. Criminal negligence is a gross negligence. So it is punishable under 106 BNS. Now I am going to discuss about infamous conduct. So very commonly asked question, infamous conduct. What are 6 A's of infamous conduct? 6 A's. Come on, guys, come on, try. A for advertisement, using large signboard, giving 1+1 offer, that is advertisement. A for association with unqualified person, that is known as covering. Covering is also question asked. A for adultery, sexual relationship with the patient, adultery, raping patient. A for alcohol. A for addiction. Yes, any other? Alcohol, addiction, adultery, association, advertisement. Any other A? Come on, try. One more A is missing here. What is that? Yes, come on, guys, answer. Abuse. Yes, okay, abuse, fine. So association known as covering. Abortion, very good. A for abortion. So any criminal abortion. So all these are basically 6 A's. So along with dichotomy. Now what is the punishment? So it can be temporary suspension of the medical practice or permanent suspension of the practice. So there can be warning. So warning, suspension or professional death sentence, PDS. So NEET PG question asked professional death sentence given by State Medical Council. State Medical Council. State Medical Council. Professional death sentence given by State Medical Council. Now, can anyone answer in case of professional death sentence, in case of any punishment given by State Medical Council, what is the next body the doctor should approach? What is the next body doctor should approach? Is it NMC or is it EMRB or Indian Association of Doctors or central government? Can anyone answer? Can anyone answer, guys? Can anyone answer? In case of any punishment given by central government, no. NMC right, but there is one more accurate answer. One more accurate answer. What is that? So the answer is EMRB. All of you write EMRB in the chat box. EMRB, Ethics and Medical Registration Board. EMRB, write this in chat box. This can be asked. EMRB, Ethics and Medical Registration Board. EMRB in the chat box. Somi Ganesh, Somi Ghosh. So EMRB, good. Then again question asked, what are 4 Ds of medical negligence? 4 Ds. So 4 Ds are duty, dereliction of duty, direct causation, and damage. So 4 Ds also can be asked in the exam. 4 Ds. So duty, dereliction of duty, direct causation, damage. All these are 4 Ds of civil negligence. So the question can be asked about res judicata, res indicata, res ipsa loquitur, novus actus interveniens. Okay, so any question can be asked. Yes, going fine. Now this is the question asked in exam. Professional death sentence given by. So what is the best answer? Best answer, guys. Professional death sentence is given by. A is the answer. Okay, A is the answer. State Medical Council. So you need to approach EMRB in that case. Okay, good. So medical negligence we discussed already. Next, all are true about civil negligence except simple absence of true care and skill, true. Patient consent is a good defense, true. Contributory is true. Punishment, it is false. False are true or false? It is also true, right? So what is the best answer then? So what is the best answer? So the answer is nil. So none is the answer. None is the answer, right? So compensation in case of civil negligence, imprisonment in case of criminal negligence. Answer is none. None. Good. So this is what given in your notes. You can go through that. Facts speaks for themselves is known as. Facts speaks for themselves is known as res ipsa loquitur. So novus actus interveniens is act of God. Gross negligence is criminal negligence. Negligence contributed by doctor and patient known as contributory negligence. Contributory negligence. So the answer is A is the correct answer. A is the correct answer. Good. Now, medical negligence is punishable under. All of you, what is the best answer, guys? Best answer? Best answer? Try. Last 10-15 minutes, we are going to complete the class. Good. Try. So answer is 106 BNS. Okay, good. Most common inquest in India. Now some questions about inquest. Most common inquest in India, police inquest. So the best is the magistrate inquest. So we discussed already. So this I am going to skip. Yes, all of you guys, how is the Josh? How is the Josh, my dear students, in forensic class? I said it should be very high, very high. We discussed so many things today. Arjun Reddy, Drishyam movie, so many interesting things in last 3 hours, last 2.5 hours. Now we are into the last part of the discussion, that is toxicology. And Joe and Swajit, okay. Yes, very high. Good. Low ho gaya sir. So Vartas low ho gaya. So fine, chalo. So shall I sing a song for you, Arun Kumar? Shall I sing a song for you? Not Hindi song, not English song. Only a Kannada song I can sing if you want. So I can make you happy. And so next half an hour we are going to discuss about toxicology. So Joe should be very high. Lunch time, sir. Okay. You want break for 10-15 minutes? Or shall I continue? Yes, guys. Yes, come on, guys. No, right. Shall we continue? Yeah. Okay. True about ideal homicidal agent except. True about ideal homicidal agent except. So I have a very nice picture there. So one of my favorite pan is there. Okay, pan. So this pan can be mixed with some cardiac poison. So the cardiac poison is aconite. So aconite is known as queen of all poisons. Okay. So true about ideal homicidal, less toxic? No. Unpleasant taste? No. Costly by price? That is also no. So the answer is signs and symptom mimics it is natural disease. So answer is aconite. So aconite resemble like natural disease, myocardial infarction. It looks like some myocardial infarction. So arsenic resemble like cholera. So this can be asked in your exam. Okay. Following is an example for organochlorines. So one more very commonly asked is organophosphates and organochlorines. Following is an example for organochlorines, not the organophosphates, organochlorines. So the answer is DDT. So all these are organophosphates. Organophosphates. So only DDT is organochlorine. Okay, you heard it as except. Okay. Chalo. So answer is DDT. Look at this. Alkyl phosphates asked in exam. HATP, TEPP, OMPA, malathion, aryl phosphates, parathion, methyl parathion, chlorothione, paraxone, digenone. Organochlorines you can see there, DDT, BHC, aldrin, chlordane, dialdrine, endosulfan, paraquat, all these are organochlorines. So this is very, very important. So alkyl phosphates, this is malathion. So mnemonic is moth, M for malathion, OMPA, TEPP, HETP. You can also see here they are very fatal. Even 175 milligram of OMPA can lead to death. One drop can lead to death, that is OMPA. TEPP also, one drop can lead to death. Malathion fatal dosage is 1 gram. So in most of the cases of organophosphate poisoning, they do consume 100 ml, 50 ml, sometime half liter. They will come to the hospital. So there is no chance of survival in that cases. Either the gastric lavage should be done immediately, then you should inject or intravenous atropine along with the prolidoxime. Okay, so alkyl phosphates. RL phosphates basically methyl parathion, parathion, diazinon, paraxone. So mnemonic is MPDP. M for methyl parathion, P for parathion, D for diazinon, and P for paraxone. Again, you can see here one drop can lead to death. So all of you write parathion, one drop. Parathion is equal to one drop. Write this in chat box. So write this in chat box. Good, come on, one drop. So one drop can lead to death in this case. Write this in chat box. Parathion is equal to one drop. So one drop is equal to dancing with Rambe Urvashi. That means death. So dancing with Rambe Urvashi means dancing with Thanatos, Greek god of death. So parathion is equal to one drop. Right? Keep writing. All of you keep writing. Good. Then treatment, as you know, atropine is given intravenously, 2 to 4 milligram. And the clinical features, very commonly asked question. So mnemonic is slurge MTF, S for salivation, seizure, sweating, lacrimation, urination, diarrhea, gastric upset, emesis, meiosis, tachycardia, fasciculation. So drug of choice is atropine. Can also give prolidoxime, diacetyl monoxime. You can also give diazepam. So the first should be atropine, then it should be prolidoxime, then it should be diazepam. So can anyone answer? Prolidoxime is contraindicated in. So this is contraindicated in. Can anyone answer? Contraindicated in. What is the contraindication? So contraindicated in case of carbamates. Okay. So what is the cause of death? The cause of death would be respiratory paralysis. And what are the postmortem findings? The postmortem findings are cyanosis, petechial hemorrhages, congestion. Okay. Yes, good. What do you mean by chlorodactyluria or chromodactyluria? Can you answer this? This is asked in one of the exam. Chromodactyluria. What is that? Chromodactyluria. Can anyone answer? Chromodactyluria. That means red color tears. in case of OP poison. So because of the porphyrins there, porphyrins. Okay, so that is okay. This is about the OP poison. So most common it is suicidal, it can be accidental, it can be homicidal also, but it's very rare, very rare. So yes or no, is it clear? OP poison, it is clear guys. So very commonly asked. And the investigation we are going to do plasma cholinesterase, that is known as pseudocholinesterase. RBC cholinesterase is the most accurate method, but most sensitive is pseudocholinesterase. So pseudocholinesterase present in the white matter and the plasma. Not chromodactyluria, not chlordactyluria, chromodactyluria. So next about the snakes. All are features of poisonous snakes except poisonous snakes. So can you try this? Poisonous snakes. It's a very, very important question, very commonly asked. Come on guys, come on. So large belly scales. So example, when you see poisonous snakes, this is the poisonous snake and this is the non-poisonous snake. In poisonous snake, you will see like this, large belly scale. So non-poisonous snake will be like this, like this. So when you see the tail, so most of the time it is pointed, but here it is round, it is round. So the answer is always rounded tail. That is wrong. It can be pointed, it is rounded in case of common cobra, compressed tail. So there are big four snakes in India. So all these are big four snakes. You can see here there are big four snakes here. Again very commonly asked. So this is common cobra. So common cobra has a hood, it has a spectacle mark. The fatal dosage 15 milligram, fatal period 30 minutes to 6 hours. So king cobra, it is 12 milligram. So what is the scientific name of common cobra? Naza is asked in the exam. Naza. So can I identify this snake? Can anyone identify this snake which has a triangular head, constricted neck, broad belly and pointed tail? What is this snake? Triangular head, constricted neck, and what is this? B. What is this B? And what is this C? And what is this D? So this is basically Russell's viper. The scientific name is Dubai russelli. Fatal dosage 40 milligram. Fatal period is 1 to 2 days. So Russell's viper is hemotoxic. It leads to DIC and death. That's why 20 minutes blood clotting test is done in case of Russell's viper. So all vipers are basically hemotoxic. Common cobra is neurotoxic. And the C, that is basically you can see the white wavy line here and the bird foot mark over the body. So 8 milligram is the fatal dosage, 1 to 2 days is the fatal period. So this is known as saw-scaled viper. So this is known as Echis carinatus. The scientific name is Echis carinatus. It is also hemotoxic. And the last one is common krait. So common krait, fatal dosage 3 to 6 milligram. Fatal period is 18 hours. It's one of the commonest snake in India. So can anyone answer, among these big four snakes, which is the most cunning snake? Can anyone answer? Which is the most cunning snake among this? So this is big four in India. Which is most cunning, like Katappa? We can say this is Katappa. Can anyone answer? This is the most cunning, which has a tendency to bite people in their sleep. In their sleep. Katappa, very famous character in Bahubali movie. You must be knowing that. Katappa. Come on, come on, come on, guys. Katappa. Come on, guys. Come on, try. Yes, very good. So this basically Katappa, common crate. Common crate is the very cunning snake. It has a tendency to bite people in their sleep. In their sleep, it resembles like stroke. It resembles a stroke. There will be minimum convulsions. There will be more paralysis. It resembles like stroke. This is asked in NEET PG exam. Following snake bite, fang marks are invisible. It resembles like stroke. Your answer must be common crate. So common crate is equal to Katappa. So very interesting, very funny. Common crate, C for Katappa, C for common crate. And 3 to 6 milligram is the fatal dosage. And cause of death is respiratory paralysis. Then treatment. So treatment is anti-snake venom. Anti-snake venom, depending upon the toxicity, mild, moderate and severe. In mild we require around 5 to 10 vials. In moderate around 10 to 15 vials. In severe we need 20 vials and more. So this can be asked in your exam. Can anyone answer neostigmine is contraindicated in, or neostigmine is not given in? So neostigmine is given in snake bite. So in which condition it is not given? Can anyone answer? No, king cobra, no. King cobra, most of the time king cobra bite, the person die within minutes. So in king cobra, the amount injected is very large. The person dies within 1 or 2 minutes only. So there is no question of survival in case of king cobra. But in common cobra, the person dies within 1 day, maybe 6 to 8 hours. You must inject ESV. Neostigmine contraindicated in. Anyone can answer? Neostigmine contraindicated in. Come on, try. Neostigmine. So neostigmine contraindicated in common crate again. So common crate. So try to memorize. Common cobra bite is postsynaptic. Common crate bite is presynaptic. So common crate Katappa, presynaptic. Presynaptic. Neostigmine can be given in cobra bite, but not in common crate bite. So this is about the snakes, and the most common side effect of ASV is anaphylaxis. No test dose is given. The dose is similar to the adults as well as in case of children. Same dose is given in that. Okay. And snake bite is a notifiable disease. Notifiable disease. Yes, guys, is it clear? Snakes, any questions? Any question? And again, snakes are classified into Elapidae. Elapidae. Elapidae means neurotoxic. Viperidae means hemotoxic. And Elapidae, Viperidae and Hydropidae. Hydropidae means myotoxic. So all these are commonly asked in the exam. Commonly asked in the exam. Say yes or no. Is it clear? Yes, come on there. Come on, students. Say yes or no. Yes or no, guys. Yes, your Joe should be very high all the time. You are having exam in 10-15 days. Okay, say yes, Yo Prasad. Okay, let me sing a song for you now. It's the time to sing a song for you. So, are you ready for the song now? Are you ready? Are you ready for the song? Ama sir. UPSC this Sunday. Okay, UPSC is there. Chalo. Yes, come on guys, come on. Are you ready? Say ready, no? Illa sir, illa. ರೆಡಿ ಇಲ್ಲ ಸರ್. ಸೊ ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು ಹೃದಯ ರಾಗದಲ್ಲಿ, ಕವಿತೆಯನ್ನು ಬರೆಯುವೆನು ಮನದ ಆಳದಲ್ಲಿ. ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು ಹೃದಯ ರಾಗದಲ್ಲಿ. Chalo, I hope you enjoyed it. So, chalo. Okay, so next few topics. Now, before that, look at this video and identify what is the answer for this question. Okay. Swajit Kumar. Look at this now. So, what is the answer for this question? That means I am singing a song for you from my heart, and that is the meaning. I am singing a song from my heart, bottom of my heart. That is the meaning of that. Okay, chalo, good. So this is what is the answer for this Cobra venom. Look at this now. Doctors are next to God. We are next to God because of, look at this video. So after giving anti-snake venom, the patient is absolutely normal, and now look at this patient is having ptosis. Patient is having weakness in talking, weakness in facial weakness, we can see there, weakness of the neck muscle, broken neck sign. So this is classical neurotoxic snake bite. And look at the snake bite here. There are 2 fang marks there. So fang marks are visible in case of common cobra. After giving the anti-snake venom, so now patient is absolutely normal. So he is returning to normal life. So we doctors are next to God. Why? Because of these wonders. Yes, good. Now look at this snake, identify, and this snake what you can see, triangular head, constricted neck, broad body, and a pointed tail. It is hemotoxic. This is classical sand viper. So you can see there the color resemble like a sand. It is normally present within the sands. So this is what type of snake it is. Look at this now. This is, so lethal dose of cobra is 15 milligram. 15 milligram. No, we discussed already. 15 milligram. It is there. So common cobra 15 milligram, Russell's viper 40 milligram, saw-scaled viper 8 milligram, common grade 3 to 6 milligram. 3 to 6 milligram. All are given in the slide. You can just go. Okay. Yes. Go through that. So what is the answer for this question? Yes, come on. This is viper. The answer is hemotoxic. So 20 minutes whole blood clotting test is done in this case. 20 minutes whole blood clotting test in case of, yes, D. Good. Bontrove smell is felt in poisoning with. Bontrove smell is felt in poisoning with. So smell very commonly asked. So arsenic, garlic smell, cyanide, bitter almond, hydrogen sulfide, fishy smell, cannabis, burnt rope. Yes, very good. So the many answered, the answer is cannabis. So what are the preparations of cannabis? Can be asked in exam. Bang, ganja, charas or hashish, cannabis oil, cannabis mazoon. Mazoon also. All is the preparation. Bang around 10 to 15. Some books is 5 to 10. Ganja around 20 percentage. Charas 20 to 30 percentage. Oil 60 percentage. Mazoon is sweet prepared from the cannabis. Sweet prepared from the cannabis. Cannabis is commonly asked, weed. And this cannabis causes run amok. Run amok. So that is a type of impulse disorder characterized by homicidal mania. So it's homicide or impulse of murder. Impulse of murder that can be asked in your exam. Cannabis. The active principle is 9-tetrahydrocannabinol. 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 And in cannabis there will be more psychiatric dependence or psychological dependence than the physical dependence. Okay, cannabis. Yeah, ASV can be given because ASV protects for snake bite. No, even vipers also, common cobra. Only one treatment is ASV, so we can start. So once there are signs of the venom toxicity, we can start. Okay, run amok. So yes, now we can see the smell here. This you can go through the notes. Zinc phosphate, fishy. Yes, rotten egg. Some student answered rotten egg in hydrogen sulfide. Yes, rotten egg in hydrogen sulfide. Zinc phosphate, that is fishy. Salicylates, menthol, naphthalene, mothball, chlorohydrate acrid. So this is NEET PG question. Acrid PO. Acrid PO, that is chloral hydrate. Chloral hydrate. Chloral hydrate. Very, very important question. Very commonly asked in the exam. Alcohol, fruity, cannabis, burnt rope, cyanide, bitter almond. All these are very commonly asked. Must know. Must know. Okay. So look at this, burnt rope and garlic smell and rotten egg. Rotten egg is hydrogen sulfide. So this is basically hydrogen sulfide. So this is basically arsenic. Arsenic smell. Speedball. What is speedball? Last question. Speedball is basically, so phencyclidine is angel dust. Angel dust. Chlorohydrate is dry wine. MDMA is a party drug. So answer is speedball is, that is heroin plus cocaine. So remember, in cocaine poison, one commonly asked question is tactile hallucination. Tactile hallucination, which is known as formication. So there will be multiple scratch marks. So in case of cocaine abuse, so there will be multiple scratch marks, probably because of the creeping bug sensation under the skin. So this is your heroin, brown sugar, and this is your white lady, that is your cocaine. Cocaine bugs. So this completes your marathon. So after the class, just go through Datura. Datura is commonly asked in the exam, frequently asked. Then cardiac poisons. Cardiac poisons, commonly asked. Cardiac poisons. And free, we can just go through the cell force poisoning. You can type in Google, you'll get the information, or in chat GPT also you'll get all information. Cell force, commonly asked. Then I think rest all I covered. So our bio warfare agents can be asked. Bio warfare agents. Warfare agents category 1, category 2 and 3 can be asked. I have that intuition that, so the question can be question can come from bio warfare agents. When you free, just go through this asphyxiants, basically carbon monoxide, carbon dioxide, hydrogen sulfide, and cyanide. Cyanide is very important topic, very commonly asked. Cyanide causes histotoxic hypoxia, so very frequently asked. It inhibits complex 4. So the treatment is sodium nitrate, amyl nitrate, and sodium thiosulfate. Cyanide is very frequently asked. Okay, it is done, no? Done from microbiology, that's fine. Rat killer, yeah, rat killer, sulfose, yes. Fun, good. Lilly's reagent, yeah, Lilly's reagent can come in exam. Jones test can come. Then gastric lavas. So go through the gastric lavas. It's a very important topic. Then the question can come from hydrogen H2SO4, nitric acid, hydrochloric acid. Okay. So that is basically from corrosives. The question can come. Corrosives. I think if you read this, more than sufficient. BNS, BNSS, BSA, all important sections are covered. All important seminal stain test, blood stain tests are covered. Differences between male and female skull, very important. Pelvis, important, covered. Then sexual offenses covered here, there, important few points. Inquest, yeah, dying deposition, dying declaration here, there, and courtroom procedure. So one more important topic is courtroom procedure. So courtroom procedure frequently asked. So there are 5 steps: oath, examination chief, cross examination, re-examination, question by the judge. So leading questions you can ask only in the cross examination. So one more question asked in exam is about the perjury. I forgot to tell you about the perjury. Can anyone answer? What is the BNS section for perjury? What is the BNS section for perjury? (227), 228, 229, and 234. So 227 is definition of perjury. 228 giving fabricated evidence, fabricated false evidence. 229 is punishment. 234 is giving wrong certificate, giving wrong false certificate. So this is favorite of NEET PG. Favorite of NEET PG. Okay. Perjury. 228, 227, 234 and on. The question can come from summons as well. So types of summons and all. Question can come from dactylography. Dactylography. That is nothing but fingerprint. Okay. Fingerprint. Gustafsson method we discussed here, there, some important points. So most common fingerprint is loop, least common is composite. Okay. So this is about the forensic marathon. I hope you enjoyed it. I hope this is very useful. I covered almost all the topics, all image based questions related to forensic medicine in I think 3 hours, 3.5 hours. Swajit Kumar, any doubt? Any doubt? Any doubt, guys? And we discussed about delusions. So interesting delusion. Brahm, right? Brahm also we discussed. And some points about insanity. Yes, Shivprasad Rentala, Yes, good. Somik Ghosh, it's very simple. So, criminal court, they have edge over, they have preference than civil court. Higher court, they have edge over lower court. Okay. When you receive two summons from the same court, then you can attend the court from which you received the summon first. Okay. So, the first rule is higher court than the lower court. Second rule is criminal court, civil court. The last rule is first come first. So, when you get summons from high court and the magistrate court, you must attend high court than the lower court. The first rule is higher court, second rule is criminal court, third rule is first come first. First come first. So, this is about the forensic medicine. I hope this will come in exam. Go Ragat Karna, section 116 BNS. One of the favorite of examiner. 116 BNS. It came in last INICET. So with this, so wish you all the best for upcoming exam. Do very well. Come with our colors. We will celebrate your success as PW Medit team. Thank you.
Good afternoon, everyone. I hope I'm audible and visible to all of you. If anybody could just confirm it once in the chat box, that would be great. So please confirm if my audio and
Good
video
afternoon,
is all
everyone.
fine.
Audible and visible to all of you. If anybody could just confirm it once in the chat box, that'd be great. Please confirm if my audio.
ठीक है. So thank you so much. So welcome to this session about NEET PG, and we have a workbook based session today. And I'm Dr. Jazeer, your dermatology faculty. And the plan for today is that we would be having a detailed session about dermatology today. So we'll spend almost 3 hours together. So we'll try to cover all the important topics that is expected from the NEET PG paper this time. And whenever you have any kind of a doubt or you would like to discuss anything additional to what we would be doing today, so feel free to drop your messages in the chat box. I'm looking forward to have a very interactive session today, and let's try to understand what is your difficulty and what all things or what all areas we could focus more to make sure that we have a very good exam that is coming up in the upcoming month, isn't it? So with your permission, I think that we can begin. So it's a workbook based session. I'm sure that all of you must have received your workbook by now. And I am also going to write down the same workbook today so that we just follow the same pattern on both the sides. So just moving further. So let's see. So Manjunath sir ka session already ho gaya. So that is about forensic, and immediately after my session we will be having Dr. Sanchit sir's ENT session as well. So I hopefully you'll be getting about a half an hour break between dermatology and ENT today. So now let's begin with dermatology. So to start with, we'll be going in a specific order. So as we expect, we are just going to start with the basic anatomy, the normal structures in the skin, and then we'll be talking about the individual diseases separately. Okay? And when we talk about the first image that we have in the workbook today, so ये कौन सा image है? Who can answer what you see in this image right now? क्योंकि ये एक ऐसा image है which is very important for any exams, be it in FMGE, be it for NEET PG or for INICET. So this is a structure that we can see in the epidermis. So this is the structure that we can see in the epidermis. And yes, Dr. Sheetal, Shivaprasad, Dr. Ram, all of you are answering that ये जो structure है ना वो कौन से level पे देखा जाता है. Like, are we going to see this in the stratum, corneum, lucidum, granulosum, spinosum, or basal? So what all of you are answering currently is correct. ये जो है, this is called as Birbeck granules. So this is called as Birbeck granules. ये जो Birbeck granules है, so these granules is also called as tennis racket cells. Tennis racket cells. And which layer? Like Dr. Sheetal is answering ki we can see this in stratum basal. Does everybody agree with her, or do you have another opinion? So please remember, ये जो Birbeck granules are there, this is seen in the stratum spinosum. This is seen in the stratum spinosum. क्योंकि Birbeck granules and tennis racket cells, which is a type of cells that they represent? They represent the Langerhans cells, right? They represent the Langerhans cells. And Langerhans cells, the function of a Langerhans cell is they play a role in the immunity, right? So they are antigen presenting cells that we can see in the stratum spinosum. So that is about the first image. And just one more point to ask you before we go to the second image is that what is the name of this investigation? Is these kind of cells, are we going to see these kind of cells in a normal microscopy, or are we going to find these kind of cells in some other kind of an investigation? So anyone? So please remember that this image that you can see here, this is a electron microscopy image. Okay, it's a electron microscopy image. It is not a normal microscopy. Very good, Dr. Tasmina. So this is a electron microscopic image. क्योंकि normal microscopy, in a normal microscopy, the Langerhans cells, they would have an appearance of dendritic cells. And so these are some of the important points that you should remember. So whenever we do a normal microscopy, so how will this Langerhans cells looks like? This is going to look like a dendritic cells. Whereas if it is an electron microscopy, the Langerhans cells is going to look like a Birbeck granule or tennis racket cells. Clear? Yes, it will be S100 positive, it will be CD1A positive, isn't it? Langerin positive, all those things would be positive as well. So these are some of the markers. Now let's see another image here. So यहाँ पे just see all these three images and can you tell me what is the diagnosis that fits in for all these three images together? The first image, what I can see here is that there is a male patient here, and in the male patient you can see that there are multiple patchy alopecia. So you get multiple patchy alopecia in this first image. So whenever you see this multiple patchy alopecia, what can it be? So यहाँ पे जो diagnosis है, the diagnosis should be Dr. Rishi, Dr. Shahrukh, Dr. Sheetal, all of you are saying that this is going to be alopecia areata. I guess all of you would agree. So ये हो गया हमारा alopecia areata. So alopecia areata में क्या होता है? The patient will present to you with multiple patchy alopecia, चाहे वो scalp में हो या फिर beard area में हो. The diagnosis is going to be alopecia areata. So this is a autoimmune disease, है ना? So in our body, if our body is going to attack our own cells, so this is going to be a autoimmune disease. ये जो second image है, so in this image there is an arrow mark given as well. So what is happening in this one? So Dr. Rishi says this is exclamatory mark here. Very good. क्योंकि this is an image of a trichoscopy, or trichoscopy में we can see a exclamation mark here. So आप सबको पता है कि what is an exclamation mark? An exclamation mark means that this is what we call as an exclamation mark. So under a trichoscopy, under a microscope, you can see that the area of the hair that is away from the scalp, they become very broad, and the area near to the scalp, they become quite thin. So this finding is called as a exclamation mark here. It can also be seen in alopecia areata. Now, who can tell me what is the third image? This third image is also a part of alopecia areata. It's also a part of alopecia areata, and I can just zoom this image for you. What are your two findings in this image? So according to me, there are two findings यहाँ पे. ये जो first finding है ना, that is going to be this one. That is going to be a patchy hair loss, right? और ये जो second finding है, यहाँ पे क्या हो रहा है? The black hair is already lost and the patient is retaining the white hair. And is there any name for this phenomenon या फिर sign? Sparing gray hair या पर patchy hair loss भी है, I agree. तो ये जो phenomenon है, what is the name for this phenomenon? The name for this phenomenon is called as turning gray phenomenon. So this phenomenon is called turning gray phenomenon. क्योंकि turning gray phenomenon में क्या हो रहा है? The patient will have a patchy hair loss, और patchy hair loss के साथ we can also find that there is a loss of black hair and a retention of white hair. A retention of white hair can be seen. So this is called as a turning gray phenomenon. Please remember, all these findings can be seen in alopecia areata. All these things can be seen in alopecia areata. So now let's also see some of the other nail findings here. तो जो next page में है अपने workbook में. So what are these nail findings? So let's do one by one. So let's see the first one. So what is this nail finding called as? So what you can see in this image right now is there is a whitish line or a whitish discoloration over the nails. अभी ये जो nail discoloration है, what is the diagnosis? If you want a clue, this can be seen in some poisoning, जैसे arsenic poisoning या फिर thallium poisoning. So in arsenic or thallium poisoning, terry nails, not exactly. Anything else? Anybody would like to try? Yes, Dr. Rishi, you're getting the right answer here. So this is called as Mees lines. So ये हो गया Mees lines. Okay, Dr. Shiva Prasad, Dr. Sauvik Ghosh, all of you are getting it right. क्योंकि whenever you see that there is a transverse white lines over the skin, over the nails, so this can be associated with Mees lines, that is seen in arsenic poisoning या फिर thallium poisoning. Whereas when you see that the nail has become white discoloration, but this white discoloration occurs because of a fungus, like this can be an example of a pseudo leukomycia. What is this image called as? This image is called as a SWO because of a overgrowth of a fungus, and this is called as superficial white onychomycosis. तो ये हो गया superficial white onychomycosis. Because what is happening here is Mees lines जो है, it's an example of a true leukonychia. What is the meaning of true leukonychia? True leukonychia. Leuco means white, nychia means nails. So example of true leukonychia is a Mees lines. An example of a pseudo leukonychia is because of overgrowth of a fungus. It's called as superficial white onychomycosis. Now coming to the next type of a nail finding. तो यहाँ पे हमें क्या दिख रहा है कि there are multiple bands, isn't it? There are multiple bands of white lines over the nails. So when you find these kind of nails, what is it called? This is called as Muirche's nails. Can anybody tell me ki in which disease can we see a Muirche's nails? So in which disease can we see a Muirche's nails? If you want examples, yeah, clues, it's associated in some patients who is undergoing treatment for cancer, or if there is a loss of protein in the blood or urine in a patient. That's the clue for you. So Muirche's lines, these can be seen in, very good Tasmina, it can be seen in hypoalbuminemia. It can also be seen in chemotherapy. It can also be seen in chemotherapy. Very good, all of you who were able to answer. So that is going to be another nail finding. Agla jo nail finding hai, that is the next nail finding which you can expect for your exam. So if you get this nails for your exam, and if I just zoom this image for you, what is our finding in this nails? Our finding in this nails is that ये जो proximal 50% of nails जो है, this has become white in color, correct? So if there is a 50% nails which has turned white in color, we can call it as half and half nails. This half and half nails is also called as Lindsay nails. Lindsay nails. So this half and half nails, in which disease or in which kind of a patient can you expect this half and half nails? So Dr. Sheetal is saying CKD, matlab chronic renal kidney disease. Dr. Shiva Prasad, Dr. Asif Ali, all of you are giving the same answer. So I also completely agree with you. We can find this in chronic renal failure. So So you can find this in chronic renal failure. अभी अगले जो image है ना, so in this image what you find here is, I'll just zoom this image for you. यहाँ पे ना 50% नहीं, almost the entire nails have become more white in color. So what is the name of this kind of a nail? जहाँ पे more than 70% of the nails has turned white in color. This should be called as a Terry's nails. So this is called as Terry nails. ये जो Terry nails हैं, in which disease can we find a Terry nails? Yes, very good, Dr. Tasmina. Very good to see that you're answering. So in which disease do you find them? We find them in hepatic failure. Yes, Dr. Sheetal, liver damage हो या फिर hepatic failure हो, वहाँ पे we can see Terry's nails, right? So these are some of the nail findings that we have discussed now. So moving further, now this is something that you can expect for your exam, where it says that there is a disease of apocrine sweat glands. Okay, this is one clue for you. Now, if a patient is presenting to you a disease of an apocrine sweat glands, where the patient is complaining of discharge, as well as you can see interconnecting bridges. Interconnecting bridges and can also be seen. Interconnecting bridges can also be seen. So based on these three clues, can you tell me what is the diagnosis? एक पेशेंट है, वो बता रहा है कि एक पेनफुल लीशन है जहाँ से डिस्चार्ज भी हो रहा है. And once you are examining the skin, you can see over the axilla of the patient there is some interconnecting bridges as well. So what is the diagnosis in this case? Very good, Dr. Shiva Prasad, Dr. Sheetal, Dr. Durgesh. So here यहाँ पे जो diagnosis है, the diagnosis should be hidradenitis suppurativa. So please remember कि hidradenitis suppurativa is going to be a disease of apocrine sweat glands. It's considered to be an inflammatory condition as well, जहाँ पे जो patient will complain of long-standing disease. Okay, this disease would be troubling the patient for several months down the line. There'll be some discharges. These lesions can get infected as well. So all those things are possible. So ये हो गया hidradenitis suppurativa. Now, at the same time, again I'm going to tell you कि the patient is having a apocrine sweat gland disease. Apocrine sweat gland disease. But now the patient is complaining of itching. Okay, the patient is complaining of itching. यहाँ पे कोई discharge नहीं है. यहाँ पे ना the complaint is going to be itching. Along with itching, on examination, you can see that there are multiple skin colored papules in the axilla. Okay, now there is a multiple skin colored papules in the axilla. So what is the answer here? Very good, Dr. Durgesh. यहाँ पे जो diagnosis होगा, this is called as Fox-Fordyce disease. Fox-Fordyce disease. So remember, this is another apocrine sweat gland disease, which is called as Fordyce disease. Now, whoever is answering this as a Fordyce spot, so I'll just write this in red, क्योंकि whenever we talk about a Fox-Fordyce disease, what you have to remember is there is a small note that you can write down in the workbook, क्योंकि जो Fordyce spots है, this Fordyce spots is not a disease of apocrine sweat glands. This is an example of ectopic sebaceous glands which can be seen over the lips or over the genitalia. Okay, so on the day of the exam, don't make a mistake. This you have to remember कि अगर जो Fordyce spots जो होता है ना, the patient will come and complain कि मेरा जो lips के ऊपर I can find some whitish spots over my lips. अगर complaint is whitish spots over the lips, this can be because of an ectopic sebaceous gland that is called as Fordyce spots. जी हाँ, ये जो ectopic sebaceous glands है ना, that can be seen over the eyes, they can be seen over the genitalia, all those regions. So accordingly the name will also change. तो कोई ट्रीटमेंट की जरूरत नहीं है, क्योंकि जो फोडाई स्पॉट्स है ना, वी विल हैव टू, नो ट्रीटमेंट इज नेसेसरी, देयर इज नो ट्रीटमेंट, जस्ट रीअश्योरेंस इज रिक्वायर्ड. वी जस्ट नीड टू रीअश्योर द पेशेंट कि कोई ट्रीटमेंट की जरूरत नहीं है. ये जो सेबेशियस ग्लैंड्स है, दिस इज ओपनिंग डायरेक्टली ऑन टू द सर्फेस ऑफ द स्किन, इसीलिए आपको फोडाई स्पॉट्स हो रहा है. So now let's go to another important topic that is going to be, that is going to be asymptomatic, Dr. Depaki. Okay. जो whoever is telling in the chat box about the ectopic sebaceous glands, जैसे मेबोमियन ग्लैंड्स हो गया, या फिर टाइसन ग्लैंड्स हो गया, या फिर फोर्डाई स्पॉट्स हो गया, so all these are the names of ectopic sebaceous glands according to the site of the lesion. Correct. So now moving to another very important topic, that is going to be acne vulgaris. So ये जो acne है ना, so in acne, this all these lesions that you can see here, so all these lesions together we call it as polymorphic lesions. Correct. So we call it as a polymorphic lesions. So why do we call this as a polymorphic lesion? Because the patient can present to you in different morphology. Like the patient can present to you with comedones, that is one, or the patient can present to you with papular, pustular, or nodulocystic lesions as well. Since all these different types of lesions can be possible, that is why we call it as a polymorphic skin lesions. अभी ये जो first image है ना, यहाँ पे ये जो first image है, what is the type of comedones that this thing is representing? These are called as open comedones, right? These are called as open comedones or blackheads. ये जो second image है, these are like very intact. ये जो open नहीं है, इसीलिए we call it as closed comedones. We call this as closed comedones as well. This is not cyclic. This can occur, any lesion can occur at any time. एक ही जो patient में you can find comedonal acne as well as you can find papillopustular acne together as well. So whenever you see these lesions, आप बस lesions को एक बार describe करने का कोशिश करो, ठीक है? So अभी ये जो acne vulgaris है, what is the kind of questions that we expect for the exam is, अगर आपको कोई भी images ऐसा मिल रहा है, so then you can just describe the lesion और इसके हिसाब से you can find that the diagnosis is acne vulgaris. एक बार acne vulgaris का clinical diagnosis हो गया, यहाँ पे कोई टेस्ट करने की जरूरत नहीं है, directly we'll have to go for treatment. अभी जो treatment है, what is the type of treatment that we give for every type of acne? मतलब all types of acne का जो treatment है, it's going to be the same except nodulocystic acne जो severe type का होता है. So what is the treatment of all the types of acne? Any answer in the chat box? So what is the drug of choice or the treatment of all the types of acne except severe acne? A very good, Dr. Ram. So Dr. Ram is saying that हमें ना topical retinoids use करना चाहिए. Topical retinoids. I also completely agree with Dr. Ram. The topical retinoids is going to be the treatment. So what is the treatment of this topical retinoid? So what are the examples? Examples हो गया जैसे adapalene or tretinoin. Adapalene or tretinoin. So that is going to be the treatment. Now, what if the patient is presenting to you with this lesion? ये जो बड़ा बड़ा जो lesions है ना, this is what we call it as a nodulocystic acne. अगर patient को nodulocystic acne है, there is no point of applying a cream here, right? तो यहाँ पे हमें ना oral tablets भी देना पड़ेगा, तो इसीलिए the drug of choice for severe acne is going to be oral isotretinoin. Oral isotretinoin, that is going to be a oral retinoid. Very good. पर अगर हम oral isotretinoin use कर रहे हैं, this oral isotretinoin comes with a lot of side effects. So So what is the most common side effect and what is the most severe side effects? ये जो side effects है, let's write it down somewhere here. The side effects can be, what is the most common? Altered lipid profile. Most common is cheilitis, says Dr. Durgesh. I completely agree with you. So यहाँ पे ना the most common side effect can be dryness of the lips. But the kind of side effect that we are always afraid of, okay, that we don't want to see is the teratogenicity. Isn't it teratogenicity? And ये जो teratogenicity का जो period है, that is going to be again important for your exam. That is going to be 1 month. ठीक है? And as all of you are answering in the chat box, कि the patient can have different type of side effects, जैसे dyslipidemia can be another side effect. The patient can also complain of night blindness. That is another side effect. Some cases can also complain of depression. That is also another side effect. So all these are going to be different side effects. Okay. So here, please remember that the teratogenicity period is going to be 1 month in the cases of isotretinoin. So now going to another disease. अभी ये जो images हैं, so see all those images and tell me one single diagnosis. ये क्या हो सकता है? So yes, all those images, I'll just zoom it for you. So यहाँ पे what we can see is the patient is having a erythematous plaque, थोड़ा scaling भी है, and these lesions can be seen in the palms, it can be seen in the axillary region. यस डॉक्टर दीपकी, अभी क्या है ना, एकनी के वजह से पहले से ही डिप्रेशन हो सकता है. डिप्रेशन कैन बी प्री एक्सिस्टिंग इन नोडुलोसिस्टिक एकनी. यस यस, वेरी गुड. सो नाउ यहाँ पे what we are going to discuss right now is going to be regarding psoriasis. We are going to discuss something about psoriasis. Now always remember, in the cases of psoriasis, the patient can present to you with erythematous plaque with silvery white scaling. और ये जो psoriasis का जो lesions है, it most commonly it is going to be seen over the extensor surfaces as well. Extensor surfaces as well. So that is about psoriasis that you have to remember. So any part of the body when you can see that there are red colored plaque lesions along with silvery white scaling, and especially if the lesions are present over this extensor surfaces, then we can think about psoriasis, right? अभी ये जो psoriasis है, here there are different types of psoriasis. One example of psoriasis is going to be plaque psoriasis, जहाँ पे ना plaque type of lesions होगा. और जो second type of psoriasis है, this is going to be pustular psoriasis. That's going to be pustular psoriasis. But what is more common psoriasis में? Is it plaque type of psoriasis या फिर pustular type of psoriasis which is more common? Please remember, the most common type would be a plaque type of psoriasis. Now seeing plaque type of psoriasis and the pustular type of psoriasis, all these are going to be pustular type of psoriasis. Now in the cases of pustular psoriasis, this can be either localized pustular psoriasis or it can be a generalized pustular psoriasis. Generalized pustular psoriasis. Now what is important for your exam is, ये जो generalized pustular psoriasis है, what is the other name of generalized pustular psoriasis? Very good. Subradas. So this is called as von Zombush reaction. Von Zombush reaction. This is called as von Zombush reaction. Excellent. Just a minute. Yeah. And these are the two types of pustular psoriasis. Now if you see this kind of an image for your exam, और अगर exams में बता रहा है कि this is a non case of psoriasis, and now the patient is complaining of massive scaling of the skin, massive scaling of the skin. Along with massive scaling of the skin, more than 90% of body surface area has turned red. Agar this is going to be the presentation of this psoriasis patient, अगर ऑलरेडी psoriasis का पेशेंट है, वो कुछ ट्रीटमेंट भी ले रहे हैं, अभी अचानक से क्या हो रहा है कि the entire body is turning red in color, and not just red in color, there is a massive scaling of the skin is also happening. तो यहाँ पे diagnosis क्या होगा? What should be the diagnosis in this case? Very good. From Subra as well as Dr. Ram, both of you are answering it. यहाँ पे जो diagnosis होगा, this should be psoriatic erythroderma. Erythroderma. And this psoriatic erythroderma, आप सबको पता है कि dermatology में we don't have too much of emergencies, है ना? But psoriatic erythroderma is one of the example of dermatological emergency. It is an example of dermatological emergency as well. Okay, and let's also see some of the nail changes in psoriasis. क्योंकि nail changes in psoriasis is also another important topic that can be asked. ये जो nail changes in psoriasis जो है ना, it is easy for you to remember it with a mnemonic, that is poison. So what is poison? Anyone? अगर there are multiple depressions over the nails like this, अगर nails के ऊपर इतने सारे depressions जो है, अगर depressions दिख रहा है आपको, तो what is it called as? Yes, very good, Dr. Sheetal. This is called as pitting of the nails. ये हो गया psoriasis का most common nail change. That is going to be irregular pitting. I completely agree with you. अभी what is the second one? The second one मतलब ये जो image है ना, जहाँ पे you can find that there is something like this over the nails. इसको क्या बोलते हैं? So this is called as oil drop sign. Oil drop sign जो सबसे characteristic nail change होता है psoriasis में, isn't it? और जो next जो changes है, that is in S, that is called as subungual hyperkeratosis. That is subungual hyperkeratosis. Very good, Dr. Sanjay Ram. This is also called as a salmon patch. जो oil drop sign है ना, it is also called as a salmon patch. I agree. ये जो image है, this is example of subungual hyperkeratosis, because just beneath the nails you can see that there is a thickening of the nails that is happening. It's called as subungual hyperkeratosis. And what is O? O stands for onycholysis. So what is the meaning of onycholysis? Onycho matlab nails, lysis means separation. So when the nail gets separated from the nail bed, इसीलिए you can see that there is a much bigger whitish discoloration here on the distal part of the nail. इसको बोलते हैं onycholysis. और ये जो last one है ना, N, this is called nail plate dystrophy. So the entire morphology of the nails are lost. So this is called as nail plate dystrophy. So please remember, all these are the different findings in the nails in the cases of psoriasis. और आपको easily ये ऐसे याद रख सकते हैं because of the mnemonic poison. Because of the mnemonic poison. Now in psoriasis, there are two more clinical signs that we will discuss today. ये जो पहले जो image है ना, ये जो image है, what is the name of the clinical sign? Anyone? तो जैसे आपने एक ग्लास स्लाइड लेके अगर आप स्क्रैपिंग कर रहे हो स्किन के ऊपर, मतलब over the lesions, once you do scraping over the skin, you can see some pinpointed bleeding spots on scraping the skin. So what is the name of the sign that you can see in psoriasis? हाँ, ये जो टेस्ट है, is it a Grettach test? ये एक बल्कली मेम्ब्रेन है या व्हाट इज द राइट आंसर? यहाँ पे RRR बोल रहा है ऑस्पिड साइन. डॉक्टर राम Som Subra is also saying it is auspid sign. So please remember, when I give this explanation, then the answer should be a auspid sign. Because whenever you see a pinpointed bleeding spots because of scraping the skin, it's called as auspid sign. ये जो process है इसको grattage बोल सकते हो, because when you are going to scrape over the skin, when the scaling becomes much more visible, it is called as a grattage test. And what is a Bulkley's membrane? Because somebody told about a Bulkley's membrane also. So Dr. Durgesh, क्या है Bulkley's membrane? ये जो scaling है ना, when the scaling they become, when it gives a shiny membrane over the skin lesion, it is called as a Bulkley's membrane. All these things can be seen as a process of demonstrating the auspid sign. So what about the next image? ये जो next image, it looks like the patient has scratched over the skin, and after scratching the skin, new lesions are appearing. New lesions are appearing at the site of trauma. At the site of trauma. So what do you call for this phenomenon when you find new lesions are appearing because of trauma? Very good, Dr. RRR, Dr. Tasmina, Dr. Sheetal, Shreya, Durgesh. I guess all of you know about this answer. This is called as Koebner phenomenon. This Koebner phenomenon, this is have one more name. Yes, this name is called as isomorphic phenomenon. This is called as a isomorphic phenomenon. And what are the diseases जहाँ पे हमें ना Koebner phenomenon देख सकते हैं? The diseases where we can find Koebner's phenomenon, just try to remember it as LVP, where L stands for lichen planus. Excellent, all of you. So V stands for vitiligo. Very, very good. So, and what is P? P stands for psoriasis. And P stands for psoriasis. Okay. So after psoriasis, let's talk about this one. So यहाँ पे ना ये दोनों images देख के मुझे एक diagnosis बताओ. So these are the two images that you have. And seeing these two images, आपको क्या करना चाहिए? पहले ये जो image है, ये image को describe करना चाहिए. So when we describe this image, you can see what is the color. ये तो बिल्कुल red color नहीं है, तो इसीलिए let us call it as violaceous or purple colored flakes over the flexural surfaces. Why do you call it as flexural surface? जो image जो दिया हुआ है ना, तो ये जो image में you can see that it is present over the wrist area. So this is going to be a violaceous or a purple colored plaque over flexural surfaces. Now what is the diagnosis? Very good. Purplish, flat, lichen planus, 𝐒𝐿 striae. These are the messages that I can see in the chat box. Amazing. So this is all called as lichen planus. और ये जो lichen planus में the lesions जो है ना, वो जो color है, this is going to be purple color या फिर violaceous. And the scaling that you can see here, the scaling is different from psoriasis. क्योंकि अभी psoriasis में हमने क्या describe किया? That was a silvery white scaling. यहाँ पे जो scaling है, this is called as a Ghom's striae, because you can find some white lacy reticulate pattern. अगर आपका नीट पीजी एग्जाम्स में पूछ रहे हैं कि कौन सा इन्फेक्शन है जो lichen planus के साथ associated है, so what is the infection that is associated with lichen planus? जी Dr. Durgesh, it is, your answer is right. The answer should be hepatitis C. Hepatitis C. That is going to be the most common association of lichen planus. What about this next two images? क्योंकि ये जो images है ना, this is also seen in lichen planus. तो ये जो image है जहाँ पे oral lichen planus है, oral lichen planus है. So in this oral lichen planus का clinical significance क्या होता है? What is the clinical significance of oral lichen planus? Will you say the patient की कोई tension की बात नहीं है, so you can just be reassured and can go back home, or are you going to keep this patient on your follow-up list? Or are you going to keep this patient on his follow-up list? Dr. Durgesh is saying this is a lacy reticular lesion, और ये lesions को वाइप ऑफ भी नहीं कर सकते. कंप्लीटली एग्री विथ यू. और पेशेंट कभी कभी ये भी बोल सकता है कि देयर इज अ कंप्लेन ऑफ अ बर्निंग सेंसेशन इन द ओरल म्यूकोसा. सो ऑल दीज थिंग्स कुड बी द कंप्लेन ऑफ द पेशेंट. तो यहाँ पे ना, यस, वेरी गुड डॉक्टर तस्मीना, डॉक्टर समसुब्रा, ऑल ऑफ यूर आंसरिंग इट. हियर देयर इज अ रिस्क ऑफ स्क्वैमस सेल कार्सिनोमा, क्योंकि ये है ना एक प्री मैलिग्नेंट लीशन है. तो दिस इज गोइंग टू बी अ प्री मैलिग्नेंट लीशन, इसीलिए द रिस्क ऑफ स्क्वैमस सेल कार्सिनोमा इज गोइंग टू बी वेरी हाई. नाउ इन द सेम पेशेंट ऑफ लाइकेन प्लानस, अगर देयर इज अ इन्वॉल्वमेंट ऑफ द स्कैल्प, तो स्कैल्प इन्वॉल्वमेंट में क्या होता है लाइकेन प्लानस में? तो देयर कैन बी अ पैची एलोपेशिया इन लाइकेन प्लानस. पर ये जो पैची एलोपेशिया जो लाइकेन प्लानस में हम देख सकते हैं, दिस इज नॉट एलोपेशिया एरियाटा. पर यहाँ पे क्या हो रहा है? दिस इज गोइंग टू लीड टू अ स्कारिंग एलोपेशिया. This is going to lead to a scarring alopecia, and this scarring alopecia is called as lichen planopilaris. So here the diagnosis becomes lichen planopilaris. So what is lichen planopilaris? It is going to be the presence of a scarring alopecia in the scalp of a patient with lichen planus. The scalp of a patient with lichen planus. Now, nail changes in lichen planus क्या हो सकता है? यहाँ पे जो image है, what is this image which can be seen in patients of lichen planus, where there is a wing shaped extension of the nails. ये जो wing shaped extension of the nails को, there is a peculiar term that we use. What is the name? This is not a pup tent sign. Pup tent sign मतलब the nails will look something like this. यहाँ पे ना, this one is called as, very good, most of you are getting it right. This is called as a pterygium. Pterygium of the nails, which is going to be a very specific या फिर a very characteristic nail finding which you can see in lichen planus. जैसे आप लोगों ने बताया, there are many other findings in the nails as well. One of the findings should be thinning of the nails, which is going to be the most common nail finding. Along with that, pup tenting of the nails can also be seen. Pup tenting of the nails can also be seen in the cases of lichen planus. So moving to another topic जो important है, that is going to be urticaria. अभी how is going to be a patient of urticaria presenting to you? Patient of urticaria का complaint यही होगा कि the patient is going to complain of very severely itchy wheals or hives under the skin. So there is going to be some water or edema underneath the skin. So the patient will complain कि there are a lot of itchy hives under the skin, which is going to disappear within 24 hours. It is going to disappear within 24 hours. That is going to be the most common presentation of urticaria. अगर urticarial lesions are present in some patient, और patient बता रहा है कि there is a lot of itching and these wheals they appear in different parts of my skin, you always will have to rule out कि what is the trigger. you have to rule out the trigger for urticaria. But my question is, what is the first line treatment for urticaria? So what is the first line treatment for urticaria? Somebody can answer. I'll just check for your answer in the chat box as well. So in urticaria, ये जो first line treatment है, is it going to be a steroid creams? Is it going to be a steroid or tablets? Is it going to be antihistamines like cetirizine or loratadine and all those things? Or is it going to be some immunotherapy? I've given you 4 options. Very good. Please remember the first line treatment is never a steroid. यहाँ पे जो आंसर होना चाहिए that is going to be antihistamines. Okay, the answer should be a antihistamines. Very good. So now let's also discuss about some of the features that you can see over the skin. अगर एक patient है and the patient after stroking over the skin and if he's developing a urticarial wheal along with how we have stroked over the skin, this is called as red dermographism, which can be seen in chronic urticaria. So this can be seen in chronic urticaria. What if you are going to just stroke over the skin और stroking करने के बाद अगर the skin is turning white in color? So if the skin is turning white in color, it is called as white dermographism. So this white dermographism, this can be seen in which disease? Anyone? Would you like to make a guess कि कौन से disease में you can see a white dermographism? White dermographism can be seen in atopic dermatitis. Can be seen in atopic dermatitis. और ये जो last image है, this last image is also an example of dermographism, even though it is going to be a little bit of a rare phenomenon. So this is called as black dermographism. And in which condition can you see this black dermographism? This can be seen in nickel dermatitis. So this can be seen in nickel dermatitis. So is that all clear? So please let me know if all of you are with me. This is about nickel dermatitis. Okay? And just moving to one more thing which we have to discuss while we are learning about urticaria. There is a disease जहाँ पे I would like to ask this as a question. Let me see if all of you can answer. If there is a child who complains to you with multiple hyperpigmented macules over the skin. So if a patient is having multiple hyperpigmented macules over the skin, and these hyperpigmented macules, if the mother says that this appears every time once a urticaria is resolved, and then there is something like if you just try to stroke over the skin of the patient will again develop urticaria as well. So what is the diagnosis here? What is the diagnosis? Multiple hyperpigmented macules over the skin along with recurrent urticaria. What is the diagnosis here? Anyone, just give it a try. So this is called as urticaria pigmentosa. So pigmentosa, क्योंकि this lesions of urticaria is leaving behind a hyperpigmented macule over the skin, इसीलिए we call it as urticaria pigmentosa. It's an example of cutaneous mastocytosis. और ये जो stroking है ना, जो what we have done just now, so this is called as diarrhea sign. So this is called as a diarrhea sign. So very good, Dr. Ram, Dr. Atrophin and Son Subra Das. All of you have got this absolutely right. So now let's see another one. Now this is another spot diagnosis for you in your OPD, in your casualty, or for your exams. On the screen, you find that you are having a patient who is presenting to you with swelling of the lips. So in this case, what is the diagnosis? Very good, Dr. S, Dr. Sheetal, Dr. Ram, all of you. So यहाँ पे diagnosis हो गया angioedema. So also tell me, what are the causes of angioedema? Jैसे if it is a child, what is the most common cause of angioedema in a child? Also, you have to tell me what is the most common cause of angioedema in an adult as well. So, yes, in the cases of children, angioedema is usually due to infection. Is due to infection. And in the cases of adults, angioedema can be due to drugs. अभी कौन सा drug है जो लेने के बाद the patient can come to you saying that I'm having a recurrent swelling over the lips or around the eyelids and all. So what is this? So that is due to some drugs, and this drugs is most commonly is going to be ACE inhibitors. It is going to be ACE inhibitors. Very good. So Dushmesh Bhatt is also answering. Som Subra, Sheetal, all of you have also answered. Now, many of you in the chat box, you have written about C1 esterase inhibitor defect, right? So where do you find a C1 esterase inhibitor defect? So C1 esterase inhibitor defect can be seen if there is no urticaria. There is no urticaria and only recurrent angioedema. So there is only recurrent angioedema. So if there is a patient who is complaining that there is a swelling of the lips, which happens very, very often, but when you examine the skin is all normal. There is no signs of urticaria and the patient denies a history of urticaria. Then you have to think about hereditary angioedema. So then you have to think about the diagnosis, that is hereditary angioedema. Clear? So thank you so much for responding in the chat box. So happy to know that all of you are able to answer these kind of questions. So now let's see another disease. ये जो disease है ना, यहाँ पे imagine करो कि this is a middle-aged patient and who is complaining of not just hypopigmentation, but the patient is complaining of depigmented skin. Is complaining of a depigmented skin. So very good, all of you are getting the answer right. So this is going to be vitiligo. So यहाँ पे जो diagnosis है, this is going to be vitiligo. So there are different types of vitiligo, जैसे focal हो गया, acrofacial vitiligo हो गया, segmental vitiligo and all those things. ये जो second image that we can see here, so this is an example of segmental vitiligo. So this is an example of segmental vitiligo. So what happens in a segmental vitiligo is this is distributed along a dermatomal distribution. So this is distributed along a dermatome. And regarding vitiligo, since it is an autoimmune disease, can anybody tell me what is the treatment of vitiligo? So the treatment part of some of these diseases like vitiligo can be asked. So tell me, what is the treatment of vitiligo? Anji, this is a unilateral lesion. It is a lesion which do not cross a midline. All those things are correct when it comes to segmental vitiligo. आप पहले ये बताओ कि treatment क्या है? So all of you are answering it as steroids. Agar exams mein this question is coming to you like what is a drug of choice or what is the topical drug of choice in vitiligo. So what is the topical drug of choice in vitiligo? So multiple of you have said steroids. So do we prefer to give a topical steroid cream जैसे मोमेंडासोन, बीटामेथासोन, क्लोबिटासोल वो करना चाहिए या फिर there is something else? Very good, RRR. This can be tacrolimus or pimecrolimus. So this can be either a tacrolimus or pimecrolimus. So what is a tacrolimus and pimecrolimus? Both are examples of calcineurin inhibitors. So both are examples of calcineurin inhibitors. And please remember, all of you were right. क्योंकि vitiligo में we can also give steroids. Steroids will not worsen the condition, but topical drug of choice अगर पूछा जाए तो answer should be tacrolimus or pimecrolimus. And Dr. Ram, as you said, phototherapy can also be done in vitiligo. Okay, so now let's see this image. So where we have the logo of PW, यहाँ पे ना, just see that behind this there is a skin lesion. ये जो skin lesion है, we can describe it as a hyperpigmented patch lesion over the face. And here, if the patient is presenting to you with a brown hyperpigmented patch over the face, यहाँ पे diagnosis क्या होना चाहिए? What should be the diagnosis? I would say one of you is right, one of you is wrong. So yes, this is called as melasma. So this is called as melasma. So whenever you find there is a brownish hyperpigmented lesion over the face, this can be melasma, and melasma can be due to different reasons, out of which one of the reason is pregnancy. Only in the MCQ, if there is a mention about pregnancy along with this kind of lesions, then the answer should be cloasma. Then the answer should be cloasma. So this cloasma, don't answer any brown color as cloasma. Cloasma is only seen in pregnancy. It is a mask of pregnancy. So when it comes to melasma, what is the treatment of melasma? What is the treatment of melasma? मतलब drug of choice क्या है? The drug of choice is yes, the drug of choice is going to be hydroquinone. Yeah, drug of choice should be hydroquinone, जो एक skin lightening agent है. So this can be used as the drug of choice in the cases of melasma. Yes, Dr. Sabha, it can be due to estrogen. पर most of the times ये जो melasma है ना, this can be due to a photo damage. So this photo damage because the patient may not be using good sun protection, जैसे SPF sunscreens अगर use नहीं करेंगे ना, तो there is a chance that the patient can develop melasma, and this melasma can also be associated with multiple endocrinological diseases जैसे hypothyroidism, diabetes, and even pregnancy. All those things are examples of reasons behind melasma. Yes, triple regimen is going to be hydroquinone along with a steroid and along with tretinoin. Very good. So now let's see another image. Now this image is absolutely different from what we have seen in melasma. तो अभी यहाँ पे क्या हो रहा है ना, तो यहाँ पे we can see multiple brown color macules. तो पहले जो melasma था, it was a patch. So melasma was a patch. Whereas if it is going to be brown colored macules, then what is the diagnosis? Very good. Tasmina, Dushmesh, Dr. Sabha, Sheetal, all of you are answering it. So here, this is going to be freckles. These freckles are also called as epilates. So what you should see on the day of the exam is, अगर patch है तो melasma है, अगर macules है then the answer should be freckles or epilates. And see the next image. ये जो next image, we will never describe this as brown color क्योंकि यहाँ पे you get a black macules or a patch over the face along with oral mucosa. So what do you call for this one? Yeah, Pius Jaggers. But I completely agree with all of you that this can be seen in Pius Jaggers syndrome. But what is the name of the skin lesion? क्योंकि अभी हम dermatology के बारे में discuss कर रहे हैं. So tell me what is the name of the skin lesion in this? Very good. So this is called as lentigenes. So lentigo maligna is different. So please remember, lentigo maligna क्या है? It is a type of malignant melanoma. Okay, and that is again more commonly seen in the face. But this is not malignant melanoma. This is called as lentigenes. So it's absolutely fine if you're making some silly mistakes today. But when you make mistakes, you are also going to learn as well, right? So it is fine, but don't make mistakes on the day of the exam. So now let's see the another one. So all these are some of the pigmentary disorders. But यहाँ पे ना, the skin is having a color that is blue color. So whenever you find a blue color discoloration over the skin, we will call it as a ceruloderma, isn't it? So in ceruloderma, what are these? Let's label all these images. ये जो first image है जहाँ पे आपको ceruloderma दिख रहा है, that is blue colored skin. So what is this first image? Yes, Dr. Sabha. Yes, ceruloderma is due to the melanocytes that is present in the dermis. इसको हम बोलते हैं dermal melanocytosis, isn't it? So because of a Tyndall effect, we can see some bluish discoloration over the skin. So the first one is called as, Shiva Prasad is answering it, as well as Dushmesh and Dr. Ram as well, Tasmina also. So this is called as Mongolian spots. So Mongolian spots is a self-limiting condition, whereas when in cases where you find there is a bluish discoloration over the face as well as the eyes, this time we call it as nevus of Ota. This is called as nevus of Ota. And what is the last one, where you find a blue discoloration over the shoulder area, and this shoulder area is called as nevus of Ito. Now, can you tell me कि अगर a patient is having nevus of Ota या फिर nevus of Ito, what is the treatment that we can give? Will applying any steroid creams or skin lightening creams, can it help? Or you would like to go for some other treatment? We have to go for other treatment, right? So कौन सा treatment चाहिए? The treatment should be laser therapy. And we can go for a Q-switched ND-YAG laser. So we can go for a Q-switched ND-YAG laser when it comes to a patient who is having a ceruloderma, especially nevus of Ota as well as nevus of Ito. So coming to another very important topic, that is a pemphigus vulgaris. So ये जो pemphigus vulgaris and other diseases हैं, all these diseases, they come under vesiculobullous diseases, right? So what is a typical presentation of a patient who comes to you with pemphigus vulgaris? क्योंकि clinical presentation is going to be very, very specific. So what is the clinical presentation in pemphigus vulgaris? Usually it should be a middle-aged patient who will complain of, always remember, the lesions or the signs and symptoms will begin in the oral mucosa. So the patient will have oral mucosal erosions. So that is going to be your first word. Always the patient will have a oral mucosal erosions. Along with that, the patient will also have flaccid bulla over the trunk as well. So what is going to be the first symptom? The first symptom is always going to be oral mucosal erosions. So that is how you can remember about pemphigus vulgaris. And in pemphigus vulgaris, it's a flaccid bulla. So that is, and this flaccid bulla, few additional points regarding pemphigus vulgaris. So यहाँ पे ना we call it as a suprabasal split, because the split happens in the stratum spinosum, and since stratum spinosum comes above the stratum basale, we call it as a suprabasal split. And these kind of patients, so what is going to be the defect in these kind of patients? The defect is going to be desmoglein 3 more than desmoglein 1. So when I say more than desmoglein 1, it always begins with desmoglein 3 defect, and the patient's symptoms will progress in such a way that the skin lesions are also present. If skin lesions are also present, you will find desmoglein 1 defective as well. And the histopathology can also show row of tombstone appearance. The histopathology will also show a row of tombstone appearance as well, isn't it? So that is about pemphigus vulgaris. So before we go into anything else, ये जो pemphigus vulgaris है ना, so in this pemphigus vulgaris there is a very important investigation that is called as a direct immunofluorescence. क्योंकि last NEET PG exam also they tested you with this direct immunofluorescence. कि direct immunofluorescence is a test done for diagnosis of so many dermatological diseases, especially in vesiculobullous disease. We use it much more frequently. So what is the DIF finding in dermatitis in pemphigus vulgaris? Very good. All of you who is answering, you will get a IgG and C3 that is deposited in a fishnet pattern or chicken wire pattern or a chicken wire pattern. So this is going to be the finding in pemphigus vulgaris. So ये जो image है ना, that is just to show you that there is an involvement of the oral mucosa as well. So now these are the images for you, because all these will give you a confirmation of diagnosis. ये जो first image है, this is the suprabasal split, and this thing, just like how it is arranged in a graveyard, so this is called as the row of tombstone appearance, and this is called as the chicken wire or fishnet pattern. Chicken wire or a fishnet pattern can also be seen. So now let's see another disease. So just see this disease. A patient is coming to you with something like this. I'm just zooming this image for you. So in this image, what I can see is that there are multiple areas of erosions, right? So when we ask the patient will tell you that there was multiple vesiculobullous lesions, and all these vesicles as well as this bulla, which is very easily breakable. So it is going to be multiple erosions, and the patients will have a very easily breakable bulla, that is a very flaccid bulla, Now, in this condition, can you tell me what the diagnosis is going to be? Very good. At least many of you are getting the right answer. So this is called as pemphigus foliaceus. So this is called as pemphigus foliaceus. Now, the most important thing in pemphigus foliaceus is there is no oral mucosal erosion. There is going to be no oral mucosal erosion when it comes to pemphigus foliaceus. Mucosal sparing होता है. And what is the type of split that you can see in the histopathology? ये हो गया histopathology image. यहाँ पे जो stratum basale is there, that is all intact. So the split is happening in the upper layers of the skin. So what is that layer of the skin which is having a split here? Yes. So this is going to be a subcorneal split. Because immediately after the stratum corneum, there comes stratum granulosum, and these lesions can be seen mostly in the stratum granulosum. And the last one is a DIF. DIF is going to be the same, that is fish net or chicken wire pattern can be seen. Fish net or a chicken wire pattern can be seen. So all of you with me? Yes. So that is about pemphigus foliaceus. Okay? That is about pemphigus foliaceus. I'll just highlight this topic as well. Now basically what you have to remember when you go for your exam is, agar vesiculobullous lesions hai in the trunk, if the question says oral mucosa was first involved, answer is always pemphigus vulgaris. And if the question says that there is no involvement of the oral mucosa, then the answer should be pemphigus foliaceus. Now here, if the question says it is an elderly patient and the patient is complaining of a tense bulla here, so which means the bulla is not breaking so easily, it is going to be a tense bulla, then what is your diagnosis? यहाँ पे जो diagnosis है, this should be bullous pemphigoid. It should be bullous pemphigoid. और bullous pemphigoid में split कहाँ पे होता है? The split that is seen in histopathology, it can be something like this. So till here was the epidermis. ये जो corneum है, granulosum, so all those layers together, it is epidermis. So the split is happening below the epidermis. So इसीलिए we call it as a subepidermal split. So this is going to be a subepidermal split. So in a subepidermal split, what do you expect in a DIF is something like this. So this is very clear that above is epidermis, below is dermis, and in between the epidermis and dermis, there is a greenish fluorescence that has been taken up. So what is present in between the epidermis and the dermis? Yes. So in between the epidermis and dermis, you can see that there is a linear fluorescence in the dermoepidermal junction or the linear or the basement membrane zone. So there is a linear type of a fluorescence in the dermoepidermal junction or the basement membrane zone. This is what we can see in cases of bullous pemphigoid. This is what we can see in cases of bullous pemphigoid. So is that all clear regarding the vesiculobullous diseases? So now moving further is let's talk about some of the malignancies here. तो यहाँ पे ना ये जो malignancy है, it is called as basal cell carcinoma. So in the last year as well, we were able to see that there are some questions that is asked from the skin malignancies. So in skin malignancy, the first one that we will learn is regarding basal cell carcinoma. So what happens in a basal cell carcinoma is you can see that the patient, what is the most, very good, all of you, Dr. Sabha, Dr. Som Subra, all of you are saying that there is going to be a rolled up border, right? So when you see a rolled up border, along with that in the center, if you can see some reddish discoloration, which can be called as telangiectasia, that is going to be the most common presentation of basal cell carcinoma. ये जो basal cell carcinoma है, the most common site is going to be the face. Now, for your exam, if they say that a 55-year-old patient presents with a disfiguring lesion over the face and the histopathology is showing peripheral palisading of the basal cells, then what is the diagnosis? Okay, so if you want, I can repeat this as well. A patient is having a lesion over the face. The lesion is disfiguring lesions over the face, and the histopathology is showing peripheral palisading of the basal cells. Then what is it? Anji, basal cell carcinoma ही है आंसर. But to be more specific, ये कौन से type का basal cell carcinoma होगा? This is going to be called as a rodent ulcer. Okay, whenever a basal cell carcinoma is destroying the tissues underneath, if there is some disfigurement that is happening, then that is going to fit under a basal cell carcinoma. That's all. That is going to be a rodent ulcer type of a basal cell carcinoma. Clear? Next one is going to be malignant melanoma. ये जो malignant melanoma, how will a patient present to you? The patient will present to you with complaints of a recent mole. Isn't it? The patient will complain that there is a recent nevus or a mole which has appeared over my skin. But this recent mole or nevus that has appeared over the skin, this is having an appearance like this. Kyunki this area is lighter, this area is darker. So is there any algorithm that we have to keep it in our mind while assessing for a malignant melanoma? So remember, this algorithm can be a B, C, D, E algorithm. So what is this A, B, C, D, E algorithm? Where A stands for asymmetry of the lesion, whereas B stands for border irregularity, C stands for color variation, D stands for diameter. Does anyone remember कि diameter कितना होना चाहिए? The diameter of the lesion should be, very good, whoever is typing the answers in the chat box, excellent. So all these things would be a revision for you. And what should be the diameter? The diameter should be more than 6 mm. Very good. The diameter should be more than 6 mm. And finally, the lesion should be evolving lesion, right? So ये जो है, this is going to be a evolving lesion. So what is it evolving in? It is evolving in the color. It's evolving in shape. It's evolving in its size as well. That is called as the evolving lesion. Very good. That is about malignant melanoma. So now let's see another one. So this is not regarding any malignancy. This is a clinical condition where a patient is coming to you with complaints of a hyperpigmentation over the axilla or groin. So all of us know that usually this area which it does not have a proper air circulation and all these body folds, जैसे axillary area हो या फिर groin area, they would be a little bit hyperpigmented. But if the patient is saying that after shaving of the axillary hair, he feels that there is a hyperpigmented area over the axilla, and this thing is actually a spot diagnosis. So can anybody tell me what is the diagnosis in this case? Very good, all of you are answering it. So this is called as erythrasma. So erythrasma. So this erythrasma is caused by, is it caused because of a fungus? Yeah, is it caused because of a bacteria? So I already have my answers in the chat box. The answer in the chat box says that it is a bacteria, and this bacteria is going to be Corynebacterium. So this Corynebacterium minutissimum, which can be causing this erythrasma. And what is the name of this investigation here? You can see that there is some reddish color that is coming out of the skin, right? So what is the name of this investigation? The investigation is going to be a Woods lamp examination. So when you do a Woods lamp examination, you can get a coral red fluorescence as well. You can find a coral red fluorescence that can be seen in erythrasma. Now let's see three other conditions, which is called as folliculitis, furuncle, and a carbuncle. So if all these are images for your exam, and how will you identify a folliculitis? How will you identify a furuncle or a carbuncle? Because all these diseases are caused by the same bacteria. So any idea what is a causative in all these three diseases? The causative of all these three diseases is a bacteria which is going to be Staph aureus. So that is going to be Staph aureus, right? So in Staph aureus, this one, the first one should be folliculitis. Because every time you get a folliculitis in the skin, they will present to you as crops of pustules. They will present to you with the crops of pustule, a lot of pustules coming together. Whereas when it comes to a furuncle, sorry, this is not a furuncle. And this the third one is a furuncle. When it is a furuncle, this is going to be a pus forming infection of a single hair follicle. So this is going to be a pus forming infection of a single hair follicle. Okay? And what about a carbuncle? When it comes to a carbuncle, this is going to be a pus forming infection of multiple contiguous hair follicle. So this is what all of you should be able to differentiate on the day of the exam. So furuncle is what we usually call as a boil. So if you find that there is a skin lesion like this, जहाँ पे एक abscess जैसा दिख रहा है, and if there is only single point that you feel, you can easily do an incision and drainage and can drain off the pus. It's called as a furuncle. Whereas if you find that there are multiple hair follicles that is involved, like in this image, so you can find that there are lot of sieve like openings and all. So this is called as a carbuncle. And if you find that there are multiple pustules over the skin, so this is going to be folliculitis. Please remember, all these conditions can be caused by Staphylococcus aureus. Now in microbiology also, you must have learned about this condition called as impetigo. So what's happening in impetigo? So what is happening in impetigo? There are two types of impetigo, and how do we differentiate it is based on the color of the crust. So what is the color of the crust when it comes to, yes, Dr. Sheetal, that is going to be honey crusting. Very good. So this is going to be golden yellow. Honey crusting can be seen when it comes to a non-bullous impetigo. So Dr. Ram, Dr. Shiva, all of you are answering it right. So here यहाँ पे क्या होता है? Golden yellow honey colored crust. When you see, this is going to be a non-bullous impetigo. Whereas what is the color of the crust when it comes to a bullous impetigo? So in the second image, you can see there is a bulla as well. So when it comes to a bullous impetigo, the color of the crust is called as a varnish crust. It's called as a varnish crust. So this crusting, the color of the crust is going to be one of the features with which we can easily differentiate the types of impetigo. And now talk about this thing. Imagine that the MCQ is saying that there is a patient who comes to you with fever, along with chills, along with a shiny skin with ill-defined borders. Ill-defined borders. Now, can you tell me what is the diagnosis? The patient is having fever. Along with fever, there is chills as well. So fever, chills, and a ill-defined border. So what is the diagnosis? Anyone? I'll just wait for your answer in the chat box. So Dr. RRR, Dr. Ram, Dr. Sheetal, all of you are saying that this is going to be cellulitis. Amazing. So this is the right answer. That is going to be cellulitis, which can be caused by either a streptococcus or a staphylococcus. And this is going to be the most common presentation of a cellulitis. Very good. So now let's see another one. So now we are going to mostly discuss about some of the fungal infections now. So in this fungal infection, just a minute. Yeah. So in this fungal infection, what do you find? यहाँ पे क्या हो रहा है? So again, let us do it in this way. I'll give you a clinical scenario. आप लोग मुझे diagnosis बताना कि ये this is going to be a child who is complaining of a painful scalp. ठीक है? So there is a child who is coming to you with a painful scalp, and once you examine, you can see that there is a patchy hair loss. But unfortunately, this patchy hair loss is going to be a scarring alopecia. Scarring alopecia. And the child is also saying that there is a domestic pet at home. Just say it can be a cat or it can be a dog. What is the diagnosis? Now, how many of you have got it right? RRR, Tasmina, Shreya, Dr. Ram, all of you have got this right. So यहाँ पे जो diagnosis है, this is going to be called as chirion. So chirion is a type of tinea capitis. It's a type of tinea capitis जहाँ पे you can find scarring alopecia. It's a very, very important topic for your exam. Has been asked multiple times for your NEET PG. So this is going to be due to chirion. Now, what about the next image? The next image is something that we see very, very commonly in the OPD, right? Because a patient will complain of a rounded lesion with scaling in the periphery and central clearing. And when you ask the patient will say that the lesion is going to have a lot of itching as well. The lesion is going to have a lot of itching as well. अभी diagnosis बता सकते हो क्योंकि in common day usage we call this as a ringworm infection. But ringworm will not be an option for your exam. So RRR, can you just give it a try and tell me ki what is the medical name for ringworm? So the medical name for ringworm should be, yes. So Ashika says tinea. Dr. Ram says tinea, but I need more than tinea. So Tasmina is right. RRR is also now getting it right. So here the diagnosis is tinea corporis. Okay, tinea corporis. So tinea corporis is what we commonly call as a ringworm. Okay, where we can find that there are rounded lesions over the skin. All these lesions are going to be itchy. Now, what if you are getting a question that a patient is having a itching in the groin area and the signs and symptoms are worsening in summers because the patient may be, sweating a lot during summers. And the KOH in this patient is now positive as well. अभी KOH पॉजिटिव है, इसीलिए आप लोग एक फंगल इन्फेक्शंस के बारे में सोच सकते हो and the patient is saying there is a lot of itching, and when you examine the skin, you can see something like this. Very good. Atropine and RRR. Sheetal is also answering. Tasmina is also answering. Dr. Rams, Somsubra as well. So this Shiva as well. So this is called as tinea cruris. ये जो टीनिया क्रूरिस है ना, समटाइम्स ऑन द डे ऑफ द एग्जाम्स आप लोग को टीनिया क्रूरिस नहीं दिखेंगे ऑप्शंस में. इंस्टेड दे मे गिव यू एन ऑप्शन लाइक दोबी एच और अ जोक एच एज वेल. कैन बी अ दोबी एच और अ जोक एच. सो दिस इज कॉल्ड एज टीनिया क्रूरिस. अब ये क्या है? व्हाट इज टीनिया इनकॉग्निटो? सो इन टीनिया इनकॉग्निटो क्या होता है? This is a fungal infection that is treated with steroids, right? It's a fungal infection which is going to be treated with steroids. Yes, Dr. Ashika, that is a fungal infection treated with steroids. Are we supposed to treat a fungal infection with steroid? Is steroid fungicidal? No. So यहाँ पे क्या होगा? All the characteristics of a fungal infection can be lost, and this is called as tinea incognito. Now tell me, what is going to be your finding if you do a KOH test in this patient? Just two options. KOH positive आएंगे या फिर KOH negative होगा. Positive and or negative. Very good, Ashika, Somsubra. So this KOH is going to be positive here. It's going to be positive क्योंकि it is a fungal infection, right? तो आप लोगों ने steroid use किया. अब steroid use करने से the fungus will not die. So since the fungus is still there, the KOH test will give you a positive KOH test. इसीलिए the treatment of a tinea incognito should be a stopping of steroids and starting of antifungals. So you have to start antifungal and we have to stop steroids. That should be the management of tinea incognito. अब next topic हो गया pityriasis versicolor. So from the name itself, we know that the patient can present to you with either a hyperpigmentation or a hypopigmentation. So the patient can present to you with either a hyperpigmentation or a hypopigmentation. So in pityriasis versicolor, so can you quickly tell me what could be the causative organism? So the cause of pityriasis versicolor can be, is it Staphylococcus aureus, Streptococcus, is it Trichophyton rubrum, or Malassezia globosa? So here the right answer should be Malassezia globosa. More than Malassezia furfur, because Malassezia furfur can also cause pityriasis versicolor, isn't it? But more common these days would be Malassezia globosa. And this KOH finding of this disease is very important. I'm just zooming this image for you. तो यहाँ पे आप लोगों को क्या दिख रहा है? You can see that there are lot of fungal spores here. You can also see these long strands. So these long strands could be a fungal hyphae. So you can see fungal hyphae and spores. So these fungal hyphae and spores, is it compared to something? What is it compared to? Yes, Dr. Shiv Prasad, Dr. Sheetal, atropine, RRR, all of you are answering. This is compared to a spaghetti and meatballs appearance, or banana and grapes appearance as well. And banana and grapes appearance as well. Okay. So now let's see the next one. ये हो गया sporotrichosis. Sporotrichosis, the usual question can be that a patient presents to you with multiple nodules over the skin, and these nodules are arranged linearly. Sometimes this MCQ can also mention that there has been a history of trauma like thorn prick over the skin, like a thorn prick over the skin. So that is called as sporotrichosis. So what is the other name for sporotrichosis? I'll just zoom this image for you. यहाँ पे आपको दिख रहा है there is a nodule here, there's a nodule here, there's a nodule here. So there are multiple nodules which is arranged linearly. So why is it arranged linearly? This is arranged linearly because it is running along a lymphatics. So this is going to run along a lymphatics. That is why we call it as sporotrichosis. So this disease is also called as a rose gardener's disease. So if the question says that if we do a histopathological examination in this disease of this patient, so what is the typical histopathology finding that you can see in a patient of sporotrichosis? Any answer? I guess somebody has already written it. So Dr. Shreya has already mentioned it. It can be a asteroid bodies, right? Asteroid bodies. So that is asteroid bodies can be the typical histopathology finding that you can see in sporotrichosis. Next question jo hai, it is about mycetoma. So mycetoma, the type of question that you need to be prepared is that usually the MCQ will say that there is a farmer who is complaining of a large swelling in the ankle, isn't it? So a farmer who is unable to walk properly kyunki there is a large swelling in the ankle. So once you examine this ankle region, you can see multiple discharging sinus. You can see multiple discharging sinus, and all these lesions, they would be also having a discharge of some characteristic grains. So there would be some characteristic grains as well. And one quick question for you, that mycetoma is a purely fungal infection, true or false? So my question is, mycetoma is purely a fungal infection. Just answer to me whether it is a true statement or a false statement. Yes. So this is a false statement क्योंकि क्या हो रहा है यहाँ पे अगर the culture, if it is positive for a bacteria, this is called as actinomycetoma. Whereas if the culture is positive for a fungus, this is called as eumycetoma. So this disease can be either bacterial or it can be fungal. It is completely based on the organism that is isolated from these grains, right? So if it is bacteria, we call it as actinomycetoma. If it is fungus, we call it as eumycetoma. Very good. Thank you for all the answers in the chat box. Abhi, let's talk about one of a viral infection, and this is a spot diagnosis. So what is the spot diagnosis called? Now I'll just zoom this image for you. I can see that there are multiple dome-shaped papules here. So there are multiple dome-shaped papules here. And all these papules, if I just zoom this image, I can see कि in the center, there is a depression in the center. ये जो central umbilication जो है, central umbilication that you can see in these lesions. So what's the spot diagnosis? The spot diagnosis is going to be molluscum contagiosum. Excellent. Molluscum contagiosum. So in the cases of molluscum contagiosum, you can always find a central umbilication which will help you to make a clinical diagnosis of molluscum contagiosum. फिर से histopathology की बात करें तो what is the typical histopathology finding in a molluscum contagiosum? Yes, Sheetal, Dr. Shreya, Dr. Tariq, all of you are answering. So यहाँ पे we can see a Henderson Patterson bodies, right? So we can see Henderson, Patterson bodies. So all these are inclusion bodies that you can see in a histopathological examination. So in this image, are you also able to find one more phenomenon here? Just say there is one lesion followed by the other, followed by the other, followed by the other. So is this called by any phenomenon? So is this called by any phenomenon? So what is this phenomenon called? So this phenomenon, anyone? I'll just waiting, giving you 2 more seconds to answer. So this phenomenon is called as, very good RRR, this is called as pseudo Koebner phenomenon. So this is called as a pseudo Koebner phenomenon because new lesions are appearing due to auto inoculation, right? Due to auto inoculation of the virus. This is called as pseudo Koebner phenomenon, which can be seen in molluscum contagiosum. It can be seen in other infections, जैसे human papilloma virus infections due to warts as well. Due to warts. Abhi, we spoke about warts. So now let's talk about warts which can be seen over the genitalia. The warts that you can see over the genitalia, how are we going to call these warts? Is it condyloma acuminata or condyloma lata? So anyway, condyloma is one of the terms that we have. So is it condyloma acuminata or lata? Yes. So this is going to be condyloma acuminata. So this condyloma acuminata is nothing but genital warts. So these genital warts are caused due to human papilloma virus. अभी कौन सा human papilloma virus? Is it 2? Is it 10? Is it 16, 18? या फिर 6 and 11? So please remember, this is caused due to 6 and 11, which is both considered to be a low risk subtype. It's considered to be a low risk subtype. So if a patient presents to you with a genital warts, which we know that it can also be a sexually transmitted infection. So in these cases, what is your treatment going to be? The treatment of condyloma acuminata is going to be anyone? The treatment of condyloma acuminata, these can be with some immunomodulators, and the name of immunomodulators is going to be imiquimod or podophyllins. Imiquimod or podophyllins. So as somebody has answered about cryotherapy, अब ये बोलो कि in which scenario we will go for cryotherapy for the treatment of genital warts? कौन से सिनेरियो में we will go for treatment of genital warts with cryotherapy? So treatment of warts in pregnancy, ठीक है, should be with cryotherapy. Should be with cryotherapy. Because the reason is ये जो imiquimod and podophyllins जो है, both these are going to be teratogenic. So if it is teratogenic, we will not risk it in pregnancy. So we'll go for a safer treatment modality, and that can be a cryotherapy. Now let's talk about some genital warts, genital ulcers as well. So now in the cases of genital ulcer, I'll just give you a clinical scenario. There is a patient who will complain of a painless ulcer, painless lymphadenopathy, and when you do a dark field microscopy, you can see a corkscrew motility as well. You can see a corkscrew motility. So tell me, which is a disease जहाँ पे आपको painless ulcer और painless lymphadenopathy, पूरा silent disease, So where do you find the silent disease? Yes, most of you are getting it right. So यहाँ पे diagnosis होना चाहिए syphilis, isn't it? So this is going to be a hard chancre which can be seen in syphilis. And what is the drug of choice in the cases of syphilis? Are you going for azithromycin tablet? Are you going for a doxycycline tablet or injections of benzathine penicillin? So what is the treatment in syphilis? So the treatment here should be, the drug of choice should be benzathine penicillin, right? It should be benzathine penicillin. Now let's see another genital ulcer disease जहाँ पे ना syphilis से बिल्कुल opposite features होगा. So what are the opposite features? यहाँ पे ना patient complaint होगा painful ulcer. Okay, यहाँ पे patient complaint is going to be exactly opposite. जैसे painful ulcers होंगे और painful lymphadenopathy भी होंगे. So there would be painful. So there would be painful lymphadenopathy as well. Now can you tell me the answer what this can be? Yes. So यहाँ पे diagnosis होगा chancroid. So this chancroid is caused due to Haemophilus ducreyi, isn't it? So it can be caused due to Haemophilus ducreyi. Now this painful lymphadenopathy, many of the times they use this word which is called as buboes. So what is the meaning of a bubo? The bubo means that the lymph node hai, it is going to contain pus. So lymph node containing pus is called as a bubo. A bubo can be seen in two diseases basically, like one is chancroid, the other one can be LGV. Okay? Now what is this peculiar pattern that you can see in a gram staining of Haemophilus ducreyi? So what is this peculiar pattern? Very good, Dr. Shiva Prasad. So this gram staining pattern is called as a school of fish pattern or a railroad track pattern. The school of fish or railroad track pattern can be seen in chancroid caused by Haemophilus ducreyi. Now, if you are getting any image-based question like this, it is the easiest image-based question that you can expect from genital ulcer disease. क्योंकि यहाँ पे the patient का complaint होगा painless ulcer. But when you examine this ulcer, what you can find is this is beefy red in color. So why am I saying this is a very easy image-based question? क्योंकि this is the only disease जहाँ पे आपको red color genital ulcer दिखेगा और this can bleed to touch as well. Bleed to touch as well. So what is the diagnosis here? Painless ulcer, beefy red in color that bleeds to touch. Dr. Ram, RRR, all of you. So here the diagnosis is going to be donovenosis. So here the diagnosis is going to be donovenosis. अभी ये जो donovenosis में what is this? यहाँ पे आपको दिख रहा है something like this and something like this. So what is this appearance compared to? ये जो appearance है, this is compared to a closed safety pin appearance. So there is a closed safety pin appearance. It is due to donovenosis, isn't it? This is called as Donovan bodies. So this is called as Donovan bodies. Okay, all clear? So now let's go to the next one. Now this herpes genitalis, as all of us know, that this is caused due to herpes simplex virus, mostly as HSV2, and this is one of the most common causes of genital ulcer disease. So what is the most common causes of genital ulcer? It is not syphilis, it is not chancroid, it is not donovenosis, it is not LGV, but the most common cause is due to herpes genitalis, which is caused by HSV. अभी यहाँ पे ना, what you should remember is these kind of patients, they always present to you with vesicles in the genitalia. and these vesicles in the genitalia, they would rupture to form erosions, and these erosions, if it is not treated, they can become painful genital ulcers. Painful genital ulcer. So the most common complaint here will be the patient will have a genital ulcer which is painful, and a painful lymphadenopathy as well, So this is called as the presentation when it comes to herpes genitalis. Okay? Now let's see what is happening in the cases of scabies. Now we all know that scabies is a mite infestation. So the causative organism, can anybody write in the chat box ki what is a causative organism in scabies? So what is the causative organism in scabies? 2 more seconds for you before I explain to you about what's a causative. Yes, very good, Dr. Shiva. So this is called as Sarcoptes scabies. So the Sarcoptes scabies is a mite which we can see underneath the skin, which will cause very very severe itching, right? So यहाँ पे जो complaint होगा patient का severe itching होगा along with nocturnal exacerbation. Very good. Atropine, Sarcoptes scabies var hominis is what he says. Amazing. Very, very good. So in this scabies, what is the skin lesion that we are looking for? Well, based on this lesion, we can even make a clinical diagnosis of scabies. यहाँ पे जो skin lesion है, that is more specific, is going to be called as a burrows, right? It is called as a burrow. So when you find that there are burrows, very good, Dr. Ram, we can make a clinical diagnosis of scabies. Now, scabies, in the last exam, you got a question, like in INICET, you got a question regarding the treatment part of scabies. Now, quickly tell me what are the different treatment modalities that we have for the management of scabies? What all can you use? हमारा जो drug of choice होता है, that is going to be permethrin. And usually 5% of permethrin is used. Okay, very good, Sheetal. 5% permethrin, I agree. Som Subra, I agree. Can anybody tell me something other than a permethrin which can be used for the management of scabies? So for management of scabies, we can also go for a tablet. Tablet form में we can go for ivermectin tablets, right? So ivermectin में क्या होगा? Ivermectin में we can use it for severe cases of scabies या फिर resistant cases of scabies में we can use it, isn't it? Benzyl benzoate says Dr. Ram, very good. That is another one. Benzyl benzoate. Sulfur can be used for the management as well. Sulfur can also be used for the management. So all these are different things that can be used for the management of scabies. Now something that comes under nutritional dermatosis is this, where a child can present to you with complaints of small papules over the elbow region. So when you can see that a child is having a lot of papular lesions over the elbow region, then what is the diagnosis? Like when you ask the mother will say that the child is not on a proper diet. He does not have a balanced diet at all. So in such cases, the diagnosis should be phrynoderma. So here the diagnosis should be phrynoderma. Okay. See, Dr. Ram, like as you are asking about what would be safe in infants. Safe in infants matlab ये जो permethrin है ना, this is safe in more than 2 months of age. Okay, scabies में permethrin जो है, it is safe for use in more than 2 months of age. If it is a very very small infant, like less than 2 months of age, sulfur is safe in less than 2 months as well. So if the question says that it is a 6-month-old infant with scabies, answer should be permethrin. So if the question says that the age is less than 2 months, then you can go for sulfur. Okay. चलो, now let's come back to the same nutritional deficiency. We were talking about phrynoderma. और ये जो phrynoderma है, this is compared to a toad-like skin. So this is compared to a toad-like skin. So in this toad-like skin, क्या होगा? This is associated with lot of vitamin deficiency. अगर कोई बोल रहा है this is happening in vitamin A, so please understand this can be seen in vitamin A deficiency, any of the vitamin B deficiency, any of the vitamin C deficiency, and even free fatty acid deficiency as well. The only exception that you can note down here is that the exception here is vitamin D deficiency. So you may not see a phrynoderma in the cases of vitamin D deficiency, but this is something that is non-specific. Okay, कोई भी deficiency में हो सकता है. अब ये क्या है? अभी आपको अगर ऐसा एक image मिल रहा है which is coming from a nutritional deficiency and you have a beautifully arranged rash over the neck region, so it can be compared to some necklace. So what is that? Dr. Palash, crotamitone is something which will help to alleviate the itching, but still it may not have a complete, property when it comes to killing the mites. Okay? So crotamitone can be used for alleviating the itching, but it may not serve the entire purpose. So crotamitone will not be the first line agent. Yes. So this is niacin deficiency. And the name of the disease is going to be pellagra, isn't it? And what is the two images that we have given here? The first image jo hai, this is called as Kezl's necklace. Kezl's necklace. And what is the second image that you can see here? यहाँ पे ना, if you find that there is a shiny rash, especially over the dorsum of the hands, so this is called as a gauntlet sign. So this is called as a gauntlet sign. This can also be seen in vitamin. So what is this niacin? Is it vitamin B1, B2, B3, B6, B12? Because we have different types of vitamin B, right? So यहाँ पे ये कौन सा vitamin है? To be more specific. Yes, so this is going to be vitamin B3 deficiency. Very good. It's going to be vitamin B3 deficiency. Now, can you see this image and give me a spot diagnosis? मैं आपको कोई history भी नहीं दे रहा हूँ. अगर this is such infant and let's say this is less than 1 year old child who is complaining to you with complaints of periorificial dermatitis. So this is a periorificial dermatitis because you can see the rash around the anal mucosa, around the nose, around the eyes, around the mouth. So what is this? Very good. All of you are able to answer it. So ये कोई diaper rash नहीं है. This is going to be due to deficiency of zinc. है ना? This is due to deficiency of zinc. जहाँ पे this is called as acrodermatitis enteropathica. So this is called as acrodermatitis enteropathica. So यहाँ पे the other complaints, the other symptoms will also be there, like diarrhea as well as alopecia as well. So diarrhea hoga, alopecia hoga, along with all those things. If you find a periorificial dermatitis, then think about zinc deficiency. It is called as acrodermatitis enteropathica. Acrodermatitis enteropathica. So out of all the cutaneous drug reaction, this is one drug reaction which is very important for your exam. जहाँ पे the patient is developing a hyperpigmented lesion that is hyperpigmented macule or a patch, especially over the genitalia or the lips, and this lesion developed after ingesting a drug. Okay, so what is this called as? Fixed drug eruption. So in fixed drug eruptions क्या होगा? When the patient is going to retake a drug, मतलब when the patient is going to retake the same drug, the lesion in the skin reappears at the same site. Okay, imagine करो कि एक patient has taken a NSAIDs like a piroxicam. ये पायरोक्सिकैम टैबलेट लेने के बाद ये पेशेंट इज डेवलपिंग अ हाइपर पिगमेंटेड मैक्यूल ओवर द लिप्स. अब 2 महीने के बाद या फिर कुछ हफ्तों के बाद अगर पेशेंट पायरोक्सिकैम टैबलेट फिर से ले रहे हैं, देन क्या होगा? द लीशन विल रीअपियर एट द सेम साइट. इसको बोलते हैं फिक्स्ड ड्रग इरप्शन. दैट इज गोइंग टू बी अ कॉमन type of a cutaneous drug eruption that can be seen in the skin. Okay, that's called as a fixed drug eruption. Abhi, whatever we discussed was not a very severe thing. आपको सिर्फ एक हाइपर पिगमेंटेशन हो रहा था स्किन में. अगर a patient is coming to you after taking a drug with massive peeling of the skin, where the patient looks like a burns patient, along with that, agar the patient is having a involvement of at least two mucosa. Okay, यहाँ पे जो clinical scenario होगा, जैसे after a patient is taking a tablet of amoxicillin, जो बहुत ही commonly prescribed antibiotic है, तो ये antibiotic लेने के बाद अगर वो patient वापस आ रहा है with complaints of massive peeling of the skin like this, along with the involvement of the oral mucosa, then it is called as a Stevens-Johnson syndrome या फिर toxic epidermal necrolysis. Now, how is a Stevens-Johnson syndrome different from a toxic epidermal necrolysis? It is based on the body surface area. Agar the body surface area involvement is going to be less than 10% body surface area, we call it as Stevens-Johnson syndrome, right? So what is the criteria for toxic epidermal necrolysis? कितना percentage body surface area involvement होना चाहिए? Yes, there should be more than 30% of body surface area involvement to call it as 10. So what is more severe? More severe would be toxic epidermal necrolysis. Abhi, if I apply a pressure over the skin like this, tangentially, then the skin will peel off. What is the name of this sign called? So in this patient, the name of the sign is called as pseudo-Nikolsky sign. The pseudo-Nikolsky sign is seen in Stevens-Johnson syndrome or toxic epidermal necrolysis. But there are lot of diseases जहाँ पे you can find a Nikolsky sign. So what are the diseases जहाँ पे आपको Nikolsky sign देखने को मिलता है? That is pemphigus vulgaris. That can be pemphigus foliaceus, or it can be staphylococcal scalded skin syndrome. So in all these diseases, we can see that there is a Nikolsky sign. Clinically क्या हो रहा है? It's going to be the same sign. We call it as Nikolsky and pseudo-Nikolsky only because in Nikolsky, the reason is because of acantholysis. Okay, the cell to cell separation होता है. That is why we call it as Nikolsky. पर in pseudo-Nikolsky as in Stevens-Johnson syndrome, यहाँ पे कोई acantholysis नहीं होता. तो यहाँ पे what you can see is there is a necrosis of the keratinocytes that can be seen. Okay. Som Shubhra, Sheetal, all of you, whoever is answering is right. अभी Dr. Ram is already saying कि अगला जो image है, it's called as acanthosis nigricans. Do all of you agree with Dr. Ram? So is it acanthosis nigricans? Yes. So what is acanthosis nigricans? तो ये जो अकैंथोसिस नाइग्रिकेंस है, इसमें क्या होगा, द पेशेंट विल कंप्लेन ऑफ अ डार्क वेलवेटी स्किन लीशन इन द एक्सिला और द ग्रोइन। तो जब आप लोग एक एमसीक्यू बेस्ड एग्जाम्स के लिए प्रिपेयर कर रहे हो, इट्स वेरी इंपॉर्टेंट टू नो कि देयर वुड बी लॉट ऑफ कॉजेस फॉर अकैंथोसिस नाइग्रिकेंस। अभी इसमें what is the most common cause of acanthosis nigricans? What is the most common cause? The most common cause would be, I'm getting many answers in the chat box, जैसे insulin resistance, I agree. Paraneoplastic in some cases, yes, I agree. So what is the most common? Metabolic syndrome is also given. Obesity is given. So what is the right answer? I would say that obesity is going to be the most common cause. So along with obesity, there can be many other reasons. जैसे polycystic ovarian disease होगा, metabolic syndrome हो सकता है, insulin resistance हो सकता है, isn't it? So all those things are different reasons, but one of the most common causes is going to be obesity. And now let's also discuss about leprosy, क्योंकि आप सबको पता है कि in all the diseases that we have, which is most probable for your exams, leprosy is one of the topic which is guaranteed, right? So one mark, I mean one question is for sure. तो यहाँ पे when it comes to leprosy, we all know कि we divide leprosy into two types, into a spectrum of disease. जो spectrum of disease जो होता है, the name of the classification is Ridley-Joplin classification. So let's compare what is happening in a tuberculoid type and a lepromatous type. क्योंकि ये जो tuberculoid type of leprosy है, in this type of leprosy, we will find some lesions like this, isn't it? So what is happening with the skin lesions and the size? We will see about 1 to 3 lesions only, but the size of the lesions is going to be big lesions, and they are going to be asymmetrical lesions. Asymmetrical lesions. Now what happens when a patient is having a lepromatous type of leprosy? When the patient is having a lepromatous type of leprosy, the skin lesions, they become something like this. मतलब 1 to 3 lesions जो था in tuberculoid type of leprosy, now it becomes numerous lesions. And these numerous lesions are also going to become smaller in size, and importantly, they become symmetrical lesions. And importantly, they also become a symmetrical lesion. Now let's talk about sensation. अब सबको पता है कि when do we suspect a leprosy in any patient? कोई भी patient में when are we going to suspect leprosy? Are we going to suspect a leprosy when a patient is coming with plaque lesions with scaling, या फिर vesiculobullous lesions in the body? So when will we suspect leprosy is my question. So we will suspect leprosy whenever a patient is having a hypopigmented patch या फिर erythematous lesion along with a sensory deficit, right? So ये जो sensory deficit and involvement of the nerves and all plays a very crucial role in suspecting a leprosy. Yes, very good, Tasmina and Sheetal. Tasmina says hypoanesthesia. It's a very good term that can be used. Now, यहाँ पे जो sensation है, in every type of leprosy, there would be a localized sensory deficit. So there can be a localized sensory deficit. But in the cases of a patient with lepromatous type of leprosy, along with localized deficit, there can be a diffuse deficit as well. There can be a diffuse deficit as well. So why do I call it as a diffuse deficit? Diffuse deficit as in a glove and stocking deformity. As in a glove and a stocking type of a deformity can be seen. Now, there is an investigation which is called as a skin slit smear. Now, if you do a skin slit smear in patients of leprosy, in the types of tuberculoid, it will be very difficult to identify or to appreciate a bacteria under a microscopy. इसीलिए most of the times SSS would be negative in the cases of tuberculoid type of leprosy. Whereas what happens in the cases of lepromatous leprosy is going to show a lot of bacteria. So it is going to be very strongly positive, that is 4+. Now, who can make a guess what happens with the lepromin test in tuberculoid leprosy? The clue is tuberculoid type of leprosy में अगर आप लोग एक बैक्टीरिया को इंजेक्ट कर रहे हो underneath the skin, then since the immunity of the patient is very good, the patient's body may respond to it. So what is it going to be? Shiva Prasad says it is going to be positive. I also agree with Shiva Prasad. The lepromin test should be positive. So Shiva, Sheetal, Dr. Ram, all of you are getting the right answer. But since the patient of lepromatous leprosy, उनका तो immunity, cell-mediated immunity is already weak. तो आप बैक्टीरिया को अगर इंजेक्ट कर रहे हो अंडर द स्किन, द पेशेंट्स बॉडी विल नॉट शो एनी रिएक्शन, isn't it? तो इसीलिए this is going to be negative when it comes to a lepromin test. Now, clinically, when you get a patient of leprosy, how are you going to say that the patient is having a tuberculoid type, या फिर lepromatous type, या फिर borderline types and all? So there is something that is very peculiar as well. So let's see how does a patient present to you in different types of leprosy. If the MCQ is going to give you a topic like there is a child with hypopigmentation over the face along with sensory deficit, in these cases you will have to keep two differential diagnoses in your mind. The differential diagnosis would be, one is indeterminate leprosy, versus pityriasis alba. The very important thing that all of you should have in your mind, because the patient is having a sensory deficit, so it can be leprosy, but keep one differential diagnosis as pityriasis alba. Alba में कोई sensory deficit नहीं होगा. It can be associated with some atopy, like some allergy, dry skin and all, but there definitely would be scaling when it comes to pityriasis alba. That is one of the clinical scenario, isn't it? The second clinical scenario is, agar the patient is presenting to you with a hypopigmented patch, 3 big hypopigmented patches over the skin, along with a saucer right way up appearance. So all of us know a cup and a saucer, right? Cup, saucer. So if there is a saucer right way up appearance, this is going to be called as a TT type of leprosy, tuberculoid type of leprosy. Clear? That is going to be the clue for you in the MCQ. Now let's see another one. ये जो already exams में पूछा था, this type of question, that what is your finding in a BT type of leprosy? In BT type of leprosy, there will be 2 additional points additional to a hypopigmented patch or a erythematous patch. What is that? One is a satellite lesion can be seen. The second one is pseudopodia can also be seen. Pseudopodia can also be seen. I'll just zoom this image for your understanding. If there is a erythematous plaque lesion or a hypopigmented patch lesion, if you can find some smaller lesions just outside the main lesion, ये हो गया हमारा satellite lesion. And when you examine the lesion, if you see that there is some projections like this, finger-like projections, अगर दिख रहा है आपको, it's called as a pseudopodia. It's called as a pseudopodia, finger-like projection. That is seen in BT type of leprosy. Now, we have discussed TT type, BT type. अगला जो type है वो हो गया BB type of leprosy. अभी BB type of leprosy में क्या होगा कि earlier we have learned कि यहाँ पे ना saucer right way up appearance है. Now here there is a inverted saucer. Okay, there is a inverted saucer appearance. So if the MCQ says patient presents with multiple hypopigmented patches and hypoanesthesia over the patches, along with hypoanesthesia, you can see that there is a inverted saucer appearance or a Swiss cheese appearance or a punched out type of a lesion. So all these things, it can be because of a BB type of leprosy. ये आपके लिए बहुत important clinical clue होगा. The next one is less likely, that is BL type. अभी BL type में उतना ज़्यादा specific findings तो नहीं है, तो you can just note it down कि यहाँ पे जो hypopigmented lesions होते हैं, that almost start becoming symmetrical here. They almost start becoming symmetrical when it comes to BL type of leprosy. Okay, अभी ये जो last image जो दिया हुआ है, so ये जो image, the face that you see in this image, so what is inverted saucer? यार inverted saucer क्या है ना, ये जो cup और saucer जो होता है, so when we invert the saucer जो appearance होता है with some floppy edges and all, वैसे दिख रहा है in the cases of a BL type of leprosy, in the type of BB type of leprosy. Okay, some textbooks compare करते हैं with Swiss cheese, some textbooks will compare it with as an inverted saucer. So all these things with an inverted edges, that is going to be called as a BB type. Okay. अभी my question was what is the name of this face जो L type of leprosy में दिखते हैं. So this type of face is called as leonine facies, isn't it? So this type of a face is called as leonine facies. So these type of leonine facies can be seen and be compared to a lion-like face. It can be compared to a lion-like face. Or in the phases, in the face of a patient who is having a lepromatous type of leprosy. So see all these lesions and tell me what is a primary skin lesion. क्या दिख रहा है आपको? यहाँ पे आपको papules दिख रहा है या फिर plaque lesions दिख रहा है या फिर nodules दिख रहा है. What is the type of lesion that you see here? So all these are multiple nodules over the face. You can see multiple nodules over the face. Along with these multiple nodules, you can also see symmetrical patches over the trunk as well. Symmetrical patches over the trunk as well. So this is going to be a very common presentation of lepromatous type of leprosy. Lepromatous type of leprosy. In lepromatous type, since the patient is already going to be immunocompromised, इसीलिए we can find a lot of other findings as well. So this cell-mediated immunity is going to be very weak in this patients. So easily you can see a saddle nose deformity. You can also find a hoarseness of voice, etc. So please remember that if you get rat bitten ears, collapsed nasal bridge, that is why we get a saddle nose deformity. So and loss of eyebrows, all those features can also be seen when it comes to lepromatous type of leprosy. Abhi leprosy, other than the clinical presentation, what is important for you is the multi-drug therapy. जो treatment कैसे होते हैं. So for the purpose of the treatment, we have divided leprosy into two types. एक हो गया paucibacillary, other one is multibacillary. Inverted saucer in borderline lepromatous. Borderline lepromatous. So we are stuck with this one, borderline lepromatous. See, what happens is when we talk about leprosy as a spectrum of disease, Dr. Durgesh, यहाँ पे क्या होगा कि पेशेंट ना यहाँ पे प्रोग्रेस हो रहा है. जैसे पेशेंट को हो गया 3 lesions when it comes to TT type of leprosy. ये 3 lesions will become about 5 lesions when the patient is moving to BB type of leprosy, and 5 lesions will become numerous lesion when it comes to BL type of leprosy. So as the patient moves from one stage to the other, the number of lesions, it keeps on increasing, the size, it keeps on decreasing, the immunity of the patient, it keeps on declining. That is how it happens. Now in many times what happens is that you will not be able to identify a proper type of a lesion. Okay, so what we can hardly say is, when typically in most of the cases, if you find a saucer right way up, if that is mentioned, it is more likely to be a tuberculoid type. When you say that a saucer, inverted saucer appearance, it is most likely to be a borderline type, especially the borderline type of leprosy. And different types of presentations can be mentioned, but we need to correlate it with what are the features that is given. Okay, all the features that can be given. Okay, so here when it comes to the treatment part also, in the treatment part again, WHO as well as NLEP both are having different types of treatment, right? But more or less the treatment is now completely aligned. Both are going to have a similar type of treatment. So what is important is you should understand ki what is multibacillary and what is paucibacillary. अभी paucibacillary का definition क्या है? When you count the number of lesions in the skin, if you find that there are less than 5 skin lesions, okay, if the skin slit smear is going to be negative and there is no nerve involvement, then we can call it as a paucibacillary type of leprosy. At the same time, you're going to count the number of skin lesions and you can see that there are more than 5 skin lesions. And skin slit smear जो आपने किया, that is going to be positive. And there is at least one nerve that is involved. And at least one nerve that is involved, then we can call it as a multibacillary. So forget about whether it was saucer right way up or inverted saucer. अभी treatment के लिए आप क्या करोगे? Just count the number of lesion, check करो कि skin slit smear positive आ रहा है या negative आ रहा है, and check करो कि अगर कोई nerve thickening है या फिर कोई nerve damage के वजह से, let's say wrist drop, foot drop या कुछ nerve damage का features है, then we can differentiate it as paucibacillary or multibacillary. Difference बस इतना ही है कि paucibacillary में we have to treat it for 6 months, multibacillary में we have to treat the patient for 12 months. अभी ये MDT है ना, multi drug therapy. तो multi drug therapy के लिए what are the drugs that we need to use for when it comes to the treatment? What are the 3 drugs? एक हो गया rifampicin. The next one is clofazimine. And the third one is going to be dapsone. So dapsone, rifampicin, clofazimine. So these are the 3 drugs that we can use for the management of leprosy. Now, many times when you start a patient for the treatment with multi-drug therapy with rifampicin, clofazimine, dapsone, after that the patient may come to you with some symptoms. So these kind of symptoms we call it as a lepra reaction. और lepra reaction में क्या होता है? So in lepra reaction, what we can see is that the patient can come with either a type 1 lepra reaction or type 2 lepra reaction. For your exams, please remember that lepra reaction is not a drug reaction. So this lepra reaction is not because of a side effect to these drugs. But let us try to understand, it is an immunological reaction that happens. जो immunological reaction है, what is lepra reaction? Type 1 lepra reaction जो होता है, that is going to be a type 4 hypersensitivity, or type 2 lepra reaction is a type 3 hypersensitivity. So this we can always remember with the rule of 5, because 1 plus 4 equals to 5 and 2 plus 3 equals to 5. So type 1 is type 4 and type 2 is type 3 hypersensitivity reaction. अभी सारे जो borderline type of leprosy है, they will show a type 1 reaction. जैसे borderline tuberculoid हो गया, borderline हो गया, या फिर borderline lepromatous हो गया. Now, what about type 2 lepra reaction? every lepromatous will show a type 2 lepra reaction. Now, what are the two types of lepromatous type of leprosy? The two types of lepromatous type of leprosy? Yes, that would be borderline lepromatous and lepromatous. So these are the two types which will show type 2 lepra reaction. Or last two things is, what exactly is this lepra reaction? The clinical scenario is a patient who is a non-case of borderline tuberculoid type of leprosy undergoing a multi-drug therapy with rifampicin, dapsone and clofazimine now presents to you with inflammation of existing skin lesion. With the inflammation of existing skin lesion, जैसे satellite lesions हो गया, pseudopodia हो गया, hypopigmented patches हो गया, if all those things are getting inflamed, swollen, along with involvement of nerves as well, this is called as type 1 lepra reaction. Now, see what is happening in type 2 lepra reaction. Type 2 lepra reaction में क्या होगा? यहाँ पे ना, there is no changes in the existing skin lesion. No changes in existing skin lesion. But instead यहाँ पे क्या हो रहा है? The patient will complain of fever. Along with fever, the patient will also complain of painful subcutaneous nodules in the skin. को बोलते हैं erythema nodosum, right? Erythema nodosum, that is subcutaneous nodules under the skin. That is called as type 2 lepra reaction. अभी चाहे type 1 lepra reaction हो या फिर type 2 lepra reaction हो, the treatment is going to be the same. Treatment क्या है? आपको continue multi-drug therapy, जैसे dapsone, rifampicin, clofazimine stop नहीं करना है, continue करना चाहिए. Along with that, you will have to start on steroids, जैसे prednisolone. Like steroids like prednisolone can be used for the management. Okay, that is about the treatment of lepra type 2 reaction. And as Swajit Kumar says, type 2 lepra reaction में आप thalidomide भी use कर सकते हो, but thalidomide जो है, since it is a teratogenic drug, इसीलिए वो first line में use नहीं करना चाहिए. Can be reserved as a second line drug, okay? Because the teratogenicity will be called as cocomelia, like sealed limbs for the baby who is born. And yes, Tasmina, ये जो finding आप oh my god, so sorry, ये जो finding आप बता रहे थे, that is going to be borderline lepromatous type है ना. ये जो borderline lepromatous type can show either type 1 या फिर type 2. अभी क्या होगा borderline lepromatous का? A patient who presents to you with multiple hypopigmented patches over the trunk now presents with either inflammation of the existing skin lesion, या फिर the MCQ can be the patient is presenting with fever and subcutaneous nodules in the skin. In both the scenario, आपका diagnosis होगा lepra reaction, and the treatment is going to be continue multi-drug therapy and start on prednisolone. So that is all about a very quick revision of all the major important points in dermatology. And as usual, we always expect around 5 questions from dermatology as well as few questions from the infections part of bacterial, fungal, viral and leprosy and all those things. So I will be sharing you this annotated PDF in the Telegram Sangal group for NEET PG as well. And I wish you all the very best for your exam. Nahi, in TT patients, lepra reaction is very rare. Only when the patient has progressed into borderline type, then only we can see lepra reactions most commonly. And thank you so much for interacting and being such an interactive crowd. And with very few days for the exam, I wish you all the very best. Do crack the exam with very good ranks, and all the blessings for you, all the prayers for you for a good preparation and amazing results. Thank you, Shiva. Thank you, Tasmina, Sanjay.